Is it Che No from the City Department of Health? All right, maybe we don't have, maybe
It's
he's.
like they're on the WebEx.
Yeah,
I'm here.
They're on the Zoom. Mhm.
what is that?
This is Che No from the New York State Department of Health.
Oh, fantastic. All right, so Che, you're, am I pronouncing it correctly?
Yes, sir, that's correct.
Okay, great. All right, Che, you're up first. Looks like you're sitting in the city council chambers, maybe. Can you give us a report on where we stand at the moment with COVID-19?
Of course. Well, thank you for hosting me. My name is Che No, and I am the Queens Community Liaison from the New York State Department of Health and Mental Hygiene. I am covering for my colleague Pauline Ferrante, who usually assigned to this area. She sends her regards. She wasn't able to make it today. So today I'll be giving you some basic updates about what's been going on. Sorry, give me a second. All right, thank you. I have two meetings going on at the same time, so I'm just trying to see which one I can do first. And thankfully, your meeting came up first. All right.
Okay, I just want to caution my committee members not to hold it against him that he's from Queens. Give him the privilege of being able to, we're going to give him a courtesy that he's allowed to speak to us, even though he's from another borough.
And can everyone mute themselves, please?
All right, let's get started.
Yeah.
So as of this afternoon, we have over 27.9 million reported cases in the world. In New York State, outside of New York City, we had 204,928 reported cases. In New York City alone, we have 236,983 reported cases as of this afternoon. And so far, we have had 19,099 confirmed deaths and 4,640 probable deaths. For the borough of Manhattan, Manhattan had 30,447 confirmed cases. Of those cases, 27% or 8,301 people have been hospitalized. There have been 2,535 confirmed deaths and 643 probable deaths as of this afternoon. So as you are aware, New York City is now reopening. It's been reopening for the past couple months, but there's still a transmission of COVID-19 in New York City, as you can see from the numbers that are presented every single day. All New Yorkers should follow the core 4 principles. Basically, they are stay home if you're sick, only leave for COVID-19 testing and other essential medical care or other essential errands such as groceries if you have no other way to get them. Keep physical distance, stay at least 6 feet away from other people when outside your home. Wear a face covering. You can be contagious without symptoms, and by wearing a face covering, you can protect those around you by doing so. And finally, wash your hands often with soap and water. Use hand sanitizer if soap and water are not available. So with this New York City restart, we currently have open outdoor recreation activities such as basketball, bocce ball, handball, tennis, volleyball courts, and such. Indoor recreation activities such as bowling alleys and low-risk cultural activities are open as of August 14th, 2020. So bowling alleys have 50% occupancy, face coverings required, every other lane closed, and so forth. For museums, aquariums, they are open at 25% maximum occupancy with time ticketing. Gym and health clubs, the hot topic, finally opened on September 2nd with 33% maximum capacity, special air ventilation requirements, mask and social distancing required, must use sign-in forms for everyone for contact tracing, and health screenings must occur at the door. No indoor classes are allowed. Malls have opened yesterday at 50% capacity. If the mall has the required filtration systems, masks are required, no indoor dining or loitering. Casinos are now open too at 25% capacity with the same requirements. And today we have heard from the governor that indoor dining will resume in New York City at 25% capacity. Was it yesterday? I'm sorry, I'm getting my dates confused. But the indoor dining will resume on September 30th. Temperature checks must be required. One member of each party must leave contact information for our contact tracers. No bar service is allowed. Patrons can have alcohol, but not sitting at the bar. Masks at all times are required when not sitting at the table, and tables must be 6 feet apart. Restaurants also have the air filtration requirements, and they must close by midnight. And the restaurants must post compliance phone numbers and their 25% capacity numbers. If the infection rate does not go up, we can reassess the guidelines and increase the capacity of indoor dining from 25% to 50% and so forth. November 1st is the deadline to make this determination. For businesses that have questions about restarting, they can call 1-800-727-4692. And interested individuals can visit forward.ny.gov for reopening guidance. As you're well aware, we have travel advisories in effect. So we have multiple states. I don't want to read all of them, but they seem to be a lot. Travelers coming from these states must quarantine for 14 days. And travelers are also required to complete the State Department of Health traveler forms when traveling by different transportation methods and when also arriving at checkpoints. As for schools will reopen for blended learning on September 21st. And there was a lot of discussion, and I guess they decided on a date. So schools resume on September 21st with different learning capacities. So some students will come to school every couple of days, some students will stay at home, and so forth. As for everything else, that's pretty much it. Those are the new things that happened in the past couple of weeks. And please let me know if you have any questions. Thank you.
Well, Che, first of all, I assume you have a written report maybe that you could email me so I can make sure that I include the correct items in the agenda, in the minutes.
Sure. I'll have Pauline email you the most up-to-date version of what I said tomorrow morning.
All right, thank you. And I just want to report on the statistics for our 4 zip codes, which I do at every meeting. And it looks as though we're doing a little bit worse than the last time I checked back in July. Zip code 40, which had been number 78 on the list of 177 zip codes in New York City, is now moved up to number 69 with 268 deaths. 1,317 cases. Zip code 32, which had been at the 77 spot, is now at 73 with 1,788 cases, 286 deaths. Zip code 33 was 94, is now 93 with 1,553 cases, 206 deaths. And zip code 34, which had been at the 100, ranked at number 126, is now at 119 with 887 cases and 167 deaths. So all told, in our 4 zip codes, we are now at 927 deaths, COVID-19. Back in July, we were at 910. So there have been 17 in basically the last 2 months, which is, 17 people have died, but it's not increasing at the rate that it had been a few months back. But it's we have now suffered 927 deaths from COVID-19 in our community. Are there any questions for Che? Okay, very good. Tell Pauline.
I have questions.
Okay, Sally.
I have a few. First, to what extent were you all involved in the guidelines that were given out for schools? I'm particularly concerned about the fact that it was either 26 out of 28 or 36 out of 38 schools did not have sufficient air filtration, yet those schools are open, and that was in Northern Manhattan. And it seems like decisions are being made on a citywide basis with schools opening, even though we have data down to the zip code level and community board level. So I want to know how you're involved in that. My second question is to what extent y'all are communicating with the Department of Transportation, et cetera, on the open streets, open restaurants. Again, that's a particular hotspot in our neighborhood because in many cases, the masking requirements and distancing are not being enforced. So, you know, there are areas where if you walk by them in our neighborhood, you feel like you've walked into a super spreader event. My third question is in terms of masking, I participated in the Department of Transportation with MTA. They had a few days where they recruited volunteers to serve as a mask force, handing out free masks in the subways where they're required. I wondered if you guys had considered anything like that. So
Can we go back to your first question? Are you saying that 36 out of 38 schools in our school district have insufficient ventilation?
Right.
I mean, I believe what I've read and what I've heard is that they've checked all of the schools and only found citywide maybe 20 or some number like that that needed to have modifications made for their ventilation.
Right. There was another
Where did you see this number that 36 out of 38?
I'll find it for you, and it might be 26 out of 28. There was a report on air filtration systems in northern Manhattan schools. I think it might have been in Patch or something. It wasn't specifically looking at it for COVID. It was looking at what we didn't have in our schools pre-COVID, which obviously if we didn't have it pre-COVID, we still don't have it. And I just wonder if the city's passage of systems wasn't fine enough to make sure that we actually had sufficient ventilation. I have friends that teach in these schools that are terrified to go to work.
Yeah, I don't. Che, do you have something to add to this?
Yes, so as for the schools, the City Department of Health is participating in a task force with the Department of Education and other related parties to create policies and to also take these concerns into account and make amends or try to fix them. As for that statistics you mentioned, I am not aware of it.
Okay, I can find that report and forward it to you and to Steve.
Yeah, please.
Okay.
That'd be greatly appreciated. So if we have the report, we can definitely take a look at it. But as for opening the schools, it is ultimately up to a DOE.
Right. And her second question was about the Open Streets program and how masking and social distancing gets enforced.
Yes. So with the Open Streets program, DOT is ultimately responsible for issuing the permits, and they issued a lot of them. Then the inspection and enforcement falls upon the mayor's office of special enforcement. That responsibility was relegated to that office. So they're the ones that created various task forces of different inspectors from HPD, DCA, Department of Health, Department of Buildings, Fire Department, and so forth. And they go out in droves and they, conduct inspections based on complaints and also for enforcement efforts. Our inspectors are involved in that effort. However, we're not in charge of it. So ultimately, if you have any concerns, please reach out to the mayor's office.
Okay, I do.
I believe when we did our public hearing in early August on noise pollution, I believe we had the head of that office speaking to us on and answering. I think he answered that very question at that public hearing. What?
I had a couple questions, Steve. Sorry.
Yeah, no, 1 second. I think Sally had a third.
And my third one was just, are you doing any initiatives with distributing masks? Like there were a couple of days where MTA recruited volunteers. I was one of them to go on the subways and hand out masks to people.
Yes.
It's not just that people are being jerked. I think it's in our neighborhood, it's also an economic issue.
Of course. No, we definitely agree. And the mass distributions headed up by the mayor's office as well. So they've been handing out masks through the parks enforcement personnel and any other personnel, city affiliated employees that are working in parks or targeted areas. But I can definitely reach out to find more details about where these masks are distributed on a regular basis.
Great. And it would be helpful if you would at least consider free mask dispensing machines. You could put them in pharmacies, businesses, et cetera. I know that y'all have distributed free masks to businesses, but I'm concerned about residents. So. we-
Okay,
Yes, I understand, definitely.
all right, thank you. Daryl?
Just a few things. First, from the chat, the article you were talking about, Sally,
Yeah.
Mohar put it in the chat so you can everyone can see that.
Good.
You can cut and paste that. And the question I had was about testing and the results from testing. Do you have any figures of how that is
No,
done?
hold it. We have a special speaker coming up
Oh.
very soon on that very topic.
Oh,
So
okay.
don't-
Sorry,
don't-
I jumped the gun.
But yes, you jumped the gun. Don't steal her thunder. Okay, do you have anything else for Che?
Just also to address a question in the chat about restaurant procedure. What is your understanding of how a mask should be worn once someone enters a restaurant to the point of when they leave?
So patrons must must don a face covering whenever they're not eating. So once they enter the restaurant, they sit down, they get the menu, they talk to the server, they should have the mask on. If they're consuming a beverage, consume the beverage, put on the put back on the masks. And if you're eating, you can take off your mask and do such and such. But if you're done with your business, please put on your face covering and proceed as usual until the check is cleared and you leave the establishment.
Okay, and I understand you are.
I
you
think
are-
that should be posted in more places.
Yes.
I understand you are allowed to chew while wearing a mask.
Yes.
Okay, good. Any other questions from committee members and? All right, very good. All right, thank you, Che. Tell Pauline we missed her, but you did a good job filling in.
Thank you, and I'll relay your concerns to Pauline so that she can have it figured out.
Thank you.
All right, but please send me the report as well.
Gladly.
Okay, thank you, Che. Captain Freeman, are you with us? Captain Freeman. Okay, Sarah, you jumped up a spot. Sarah Joseph Curian, the operational lead for testing at the
Yes, I'm here. Hello, how are you doing?
at the Test and Trace Corps. Daryl, she's on the agenda at your specific request.
Hello,
right,
thank you, Daryl, for advocating for my presence on the agenda.
All right, so Sarah, you have a report to give us about how the testing is proceeding in our area?
Yep, I have some citywide information and some information about testing in Washington Heights specifically. So as mentioned, Sarah Joseph Kurian, I'm the deputy lead for testing. As part of the Test and Trace Corps, I work at New York City Health and Hospitals, and I've been in the city with the city for about 5 years now. I manage, so before Test and Trace was launched by the mayor, as part of the surge in response to COVID, New York City Health and Hospitals had opened 22 testing sites, including the Dyckman testing site at the Dyckman houses in Washington Heights, but 22 across our hospitals and Gotham Health clinics. As part of the Test and Trace initiative, we opened a whole lot more clinics where the express purpose is COVID PCR testing, so diagnostic testing for COVID. We have opened somewhere to the tune of 35 testing sites. We decommissioned some of them to return them to the DOE as part of the reopening of schools. So we were in 9 school sites and 2 after school sites that we have returned to the DOE. So currently we have 24 pop-up testing sites that are open across the city. And we also have a fleet of 10 mobile units. The mobile units go to different locations every week. We ideally try to partner with NYCHA or community-based organizations to offer testing in these different locations. And as part of the universe of 24 pop-up test sites, One of them is at the High Bridge Rec Center in Washington Heights. In terms of how,
I'm sorry, you consider Highbridge to be a pop-up testing site?
yes, pop-up is I will say there's been some lively debate about the term pop-up, but essentially anything where the building or the land is owned by a city agency and is ordinarily used for a different purpose, but we have borrowed it to be tenants to do testing. That would be considered a pop-up test site. So because Highbridge is owned by the Department of Parks and Recreation and ordinarily is a rec site, we were in the pool and in the gym. Now we are just in the gym because of winds and rain making the pool tents not quite tenable for ongoing testing. We have steady engagement in Highbridge. Obviously, we're always looking for more ways to reach the community and have more people come in for testing. I also spoke with some of my colleagues in the tracing part of the world. I'm thinking about outreach in Washington Heights. I think the National Black Leadership Commission on AIDS and Trans Latinx Network have both been doing flyering and in-person outreach in the neighborhood, and there's been a variety of different virtual engagement as well. And then thinking about Washington Heights as a part of the city, obviously some might consider, right, pretty disproportionately impacted by COVID-19. So when speaking with colleagues who are tracers, as you might know, our workflow is when somebody tests positive for COVID-19, we attempt to reach them. And we also attempt to, once we've spoken with that individual, we also attempt to reach their anybody who might be considered as being exposed to COVID-19 by virtue of interaction with that individual. And when we are not able to reach the individual or those who have been exposed, or we think likely exposed, we also go door to door to see if we might be able to reach the person that way.
I don't, something's wrong with the sound where
Yeah, you're breaking up.
yeah, you're in and out.
Well, maybe we can assume that everything you didn't hear was wonderful and super erudite. I'm in the living room. I'm going to check if I can do anything about the connection or even just speak. Is this better if I'm speaking closer to the speaker?
Yeah, no, the volume is not the issue. It's you're fading in and out. But go ahead.
Okay. And through resource navigation, we also connect people to programs, including Get Food. So I know that there was a question earlier about masks, right? So at Highbridge, for example, if somebody comes to the test site and doesn't have a mask, we would give them a mask for the time. This is very different, obviously, from handing out masks for everyday use. We do want to make sure that people are protected when they're coming to a test site. And there's also, when we do our hyperlocal interventions and provide PPE care packages, masks are part of that as well. But I definitely agree that better access to masks for our communities would be helpful.
Yes, we're losing you again.
My recommendation for you is to please turn off your video and just have the audio, and I think it will be slightly better.
Is this better?
Yeah, let's see if that works. Okay.
All right, sounds good. So those were some of the top line pieces of information that I wanted to be sure to share. I'm happy to answer questions or if there's any other information that I could help cover or bring back.
Okay, so at the, is there also a testing site right now at the Department of Health building at 168th Street and Broadway, 600 West 168th Street? Is that site still up and running?
I'm sad that we lost our Department of Health colleague before that question was asked. I can double check. I'm not certain, but I'm happy to verify.
Okay, so at the moment you have the 24 pop-up testing sites and the 10 mobile units.
That's right.
And we know for sure that you have at least 2 sites in our community in Washington Heights and Inwood, and possibly a third.
There's one at Dyckman, one at Highbridge, and then I will cross-check on the DOHMH site you mentioned.
Okay, very good.
Mhm.
Okay,
Questions?
any other, Sally, you have a question?
Yeah, I have a couple questions. There's been great concern at these sites in terms of both people arriving at the sites and not feeling safe because social distancing, et cetera, is not being enforced at the site. So they go in and it does not feel safe even to be there and be tested. The bigger concern is the lag between testing and reporting of results. I'm wondering to what extent y'all are tracking that and trying to address that, because the tests,
Yes.
become useless if the results aren't there immediately. And then I have another question about the contact tracing program. I know it was a difficult rollout because y'all were brand new to it. I know that the health department tried to help you, but you were getting really low response rates. And I understand that there's still really low response rates. What is the response rate and what qualifies as a response?
Yep, so I'll try to take them in order. First with safety, we do put out signage to maintain the 6 feet apart distance, right? From folks, obviously, we don't want anybody to not be feeling safe at our sites. If you do hear of concerns around safety at the Highbridge or Dykeman sites, I can't speak for the Department of Health site. I certainly would want to hear that. And I'll also make sure to loop back with the leadership of both of those locations to cross-check how we're doing and make sure that we are abiding by the social distancing guidelines. In terms of your question about the delay, a lot of our pop-up test sites were on a lab that is well-known named Quest. And there was, I think, an article in the New York Times and several other local, state, and nationwide media reporting the delays with Quest Labs specifically. We have migrated all of our sites off of Quest Labs as of a few weeks ago. So we are seeing a much better turnaround time, more in the 48 to 72-hour window range. Obviously, we're doing everything we can to make sure that
I'm sorry, Sarah. You're seeing a much better what?
turnaround time. So getting the results. So turnaround time, we measure turnaround time based on when somebody got swabbed, right? When they had their test for COVID and when they get their results. So we're seeing that time frame shrinking from Quest. Obviously, in the most egregious of cases, was in the multi-week time window, and I definitely agree with the utility of that result being diminished by that delay. With Access DS, which is the new lab that we're on, we're seeing those turnaround times be closer to 48 to 72 hours. We have committed to a 3 to 5 day turnaround time, and we're much closer to meeting it for most of our cases. Definitely not the case 100% of the time. There's human error every now and then, but we're seeing those rates improve dramatically. And then with tracing, I know aggregate across the city, the percentage has improved pretty dramatically. What counts as a tracing connection is calling somebody and having them pick up the phone. So being able to make contact with the person, we have made a really concerted effort to have more and more tracers from the neighborhoods in New York City, right? If people are interested in being connected to tracing work in their community, we do everything we can to accommodate that, and having folks speak a variety of languages and coming from a diversity of backgrounds. So obviously, once that connection is made, we want to make sure also to sustain it and make sure that folks are getting the information they need, the connection to resources they need, and importantly also that we are getting that full universe of folks that they might have been in touch with, so we can also inform them of the possibility that they might have been exposed. But the sort of first few tries are to reach somebody by the phone, and then the community engagement specialist, which is a team under the Tracing Initiative. If we're not able to reach somebody over the phone, we will try to then see them in person.
Do we know what percentage of cases you're actually getting contacts then? So you go beyond picking up the phone to actually getting information?
I know that it is more than half the time, but I do not have a precise percentage.
If you get that percentage, and specifically in our neighborhood, as you probably are aware, we're number 4 in the city in terms of percentage of essential workers. So we're a very high risk community. So we would appreciate any data you can provide to us on how contact tracing is actually working in our specific community board district.
Absolutely. I will follow up on that. And then you mentioned essential workers. I know there's a discussion earlier about teachers. Teachers and staff, members of the DOE and daycare workers are prioritized for both access to testing and their results at 22 health and hospital sites, including all 11 of our acute care hospitals and 11 clinics, including Dykeman. And they are also prioritized in terms of access to testing across all of the pop-ups. So very committed to making sure that DOE staff, daycare staff, who are essential to the reopening of schools and other services are getting enhanced access to this.
Okay, a number of the teachers I know have gone outside the system, so maybe that needs to be better communicated.
There are, we have test sites as part of Test and Trace. We have a number of test sites that are within health and hospitals or operated by the city. And we also have partnerships with private labs that are also prioritizing teachers and DOE workers. We also have some of the DOHMH labs doing that prioritization.
But Sarah, are you saying that all of the swabs are sent to private labs to be tested? We don't have any of our own labs, either.
We
the
have
city-
yeah, it's a good question. We have a variety of interventions. So for the 24 pop-up sites and the 10 mobile units, of that universe, the 24 pop-up sites and 6 of our 10 mobile units, we do send the tests away to get processed. The remaining 22 health and hospitals, acutes and Gotham sites, and 4 of our mobile units use bioreference labs, which we don't send those away. They're processed, I think, within the city, but they're not owned by the city. I know there's intention to build up the city's own capacity to process tests. And we've also been working on strengthening our capacity to produce the actual test kits and the viral transport media that those test kits get.
I tell you, I mean, this is anecdotal, but based on people's comments that I read on the Idwood social media sites, people seem to be very satisfied with the site on Dykeman Street. What is it, 175 Nagel Avenue? That there's no waiting time. They get their results back within a few days. I think maybe in one case, someone wrote that they got their result maybe the next day. So the service at the Dykeman Family Health Center appears to be pretty good.
That's great to hear. I'll let our Gotham Health leadership know. They'll be thrilled to hear that.
Yeah.
I
All
had
right.
a few questions, Steve.
Yeah, go ahead, Darrell.
One, I was just wondering, what is your coordination with the other, like the private sites, like CityMD and things like that?
So there's that's a good question. There's a number of private sites. So private, including CityMD, right? But also qualified health centers like Damien, Morris Heights, and a number of others. We partner with a fair number of organizations to build out our overall citywide testing capacity. And we've been, with some of the partners, we provide access to PPE, right? Especially when there's been shortages with the qualified health centers and with CityMD. The nature of these partnerships differs. In general, we have to hold the line on with all of our partners that if somebody is uninsured, we do not charge them for the test. In addition to if somebody's insured, there's no cost to the patient. We bill insurance. We don't bill the patient a copay. We also wanted to make sure that access to PCR testing for uninsured folks was, not hindered. So if you see on our COVID test and trace website, there are a number of partners that are marked with access for uninsured folks is at no cost. So there's, a little bit of a difference there, but that's, we partner with PPE. We try to share standards of how we want to.
But if someone tests positive at one of those sites, you all follow up with that person, or?
Yeah, if somebody tests positive in New York City, those positive test results are reported to the state. as part of infection control protocol. So the lab, in addition to reporting it to the provider and the patient, reports it to the state, and we get the data from the state. So we get data on folks who test positive across the city, no matter where they were tested.
And also my other question was, just so I'm clear on how this works, you're only reaching out to folks who test positive for the currently having COVID-19, unlike say someone who's negative for it but has the antibodies for the first time.
That's right. We prioritize for tracing folks who've tested positive, and then once we speak to that person or people, and they let us know who else they've been in contact with, we would also prioritize all of those folks to make sure that they are able to access testing and resources.
Thank you.
Okay, any other questions?
I'm just following up on something I read
No,
recently.
no, one second, Sally, hold on. Do we, any other committee members with questions? Okay, go ahead, Sally.
There's been a number of articles that I read lately about the viral load with the test. So how many runs you have to do of the test to actually show a positive result. And I think people are using 30 or 35, and the recommendation is that's lowered. You would find fewer positives. Are y'all looking at what the load is, and can that be reported?
I'm definitely a few steps outside of my area of expertise. I'm happy to follow up with clinicians who work with us. Your question is specifically around viral load and whether that's something.
Like how positive is a positive? What does a positive mean? So if you only ran it, cycled it, I think like 25 times versus 30, you might show a positive, but at 25 you showed a negative. And so it gives some indication of how severe the infection is.
I'm happy to follow up with clinicians who work with us.
Great, thanks.
All right. All right, is there any other questions for Sarah? All right, very good. Would appreciate if you could get back to us about the site at 168th Street.
Absolutely. I think my follow-ups are the site at 168th Street. If there's any narrowing down of percentages of contacts being made in Washington Heights, and also the viral load question. So I'll make sure to follow up on all.
Yeah, and any specific data you have about Washington Heights and Inwood, our 4 zip codes would be useful to us.
I'll do my best. Thank you so much for having me.
Okay, but please convey my thanks to Dr. Long for making it, for finding you and getting you to come to us.
Will do. I'll definitely pass that on. Thank you so much. Thank you all.
All right, thank you. All right, Captain Freeman, are you with us now? Captain Freeman from EMS? Okay, Ross Fromer,
Hey, Steve, how are you?
how are you doing?
Very good, thank you. I got a lot of little stuff to go over, nothing major. And I see Julio's on, so he may follow up with some of the NYP stuff. But I cannot remember if I mentioned this in July, but Neil Rustige has taken over as the new interim dean at Columbia. Dean Goldman having stepped down as of July 1st. Dr. Rustige had been the director of our cancer center. He's a gastroenterologist by training, cancer researcher. He is now our interim dean. A couple of things we're working on.
Oh, geez.
Okay. In terms of the campus and what's going on at the medical center, we are still, largely virtual, but more and more people are coming back. Our clinics are seeing patients. The labs are operating all on reduced density, all with social distancing and a strict mask policy, and all with strict COVID protocols. In terms of some of the community outreach, this year the Medical Center Neighborhood Fund has been focused completely on food relief in Northern Manhattan. We've been working with our colleagues at Morningside and have made several large donations to pantries, food pantries throughout Northern Manhattan. We'll be doing some more over the next month. Next week is the Rally for Medical Research. Normally, we send a contingent down to DC to lobby Congress in support of the NIH and biomedical research. This year, it is virtual. We'll be conducting a series of virtual meetings with members and staff, along with colleagues from around the country, trying to drive up to support the budget for the NIH. Over the next 3 weeks, there'll be a concerted effort on campus by our students, faculty, staff, in terms of voter registration and filling out the census, posters, outreach, etc. We participated in the Summer Bridge program. Normally, we have a large role in the New York City Summer Youth Employment Program. That did not happen this year. We had about 20 youth who worked with faculty and staff at the medical center on virtual projects through the Summer Youth Program. And then just a heads up on two events. On October 4th is our virtual Velocity Ride. Each year, for the last 3 years, we've been holding a cancer fundraising bike ride, starting in upstate New York, or Rockland County, and New Jersey, finishing at the Medical Center campus to raise money for cancer research. This year's event is a virtual event. It's called Velocity Day, and whatever way people want to participate in order to raise money for cancer research, they can. This year, there is no entry fee and no fundraising minimums. So if anybody's interested in participating, you can either contact me or go to just velocityride.org, and it's very easy to sign up. And finally, two other things mentioned. Next week, we will be hosting a symposium on physician mental health issues, on mental health for providers. This event is named in memory of Dr. Lorna Breen, who you may remember is our emergency room physician who took her own life back in April. I should note that Senator Tim Kaine of Virginia and Congressman Max Rose of Staten Island have introduced legislation which they've named in honor of Dr. Breen to address the issue of mental health among healthcare providers. And then the final item is not 100% definite, but I think it's going to happen on October 14th. We will be doing our quadrennial for every 4 years CUIMC election forum. We will have healthcare experts discuss health issues in the upcoming election, policy and politics. Again, we've always invited the community. This year it will be virtual, and I will be sending out more information about that. Encourage as many people to come join us for that. That's going to be on the 14th from 5 to 7. That is a tentative date and time at this point. And happy to answer any questions that folks have.
Yeah, I got a couple of questions, Ross. First, tell me again the name of the new dean.
Anil Rustigui. It is spelled Rustgi. First name Anil, A-N-I-L.
N-E-I-L.
A-N-I-L. A-N-I-L.
And
A-N-I-L.
A-N-I-L. Oh, okay. Oh, and the last name is R-U-S-T-G-I.
Yeah. Although it's pronounced as though there's an extra little syllable in there, Rustigui. But it's
Rustigui?
Rustigui.
Okay. All right. Well, hopefully one day we'll get to meet him. Now, there was a plan, I think, to have all of the students or a fair portion of the students come back to campus. But wasn't there then a change made or decision that they should remain doing remote online learning?
This is primarily with the undergraduates down in the Morningside campus. We had hoped to bring a percentage of our students back to campus for this year. The decision was made in August to not do that for undergraduates. So there is all undergraduate learning, with perhaps some very, very minor exceptions, is now by remote. There are a small number of undergraduates on campus, either because they're from out of the country, they can't go home for whatever reason, they need housing, or they have jobs on campus, or they're frankly, they're living in the community. Our graduate students, and that's both Morningside and at the medical center, are having classes. They vary. Some are remote, some are in person, some are hybrid, and that varies from program to program and class to class. But our graduate students are in person.
So the School of Nursing, the School of Public Health, physicians and surgeons,
Yeah.
the schools that are based uptown at the medical center are some of those students are doing in-person classes and some are doing remote.
Yeah, no, generally, the larger lecture classes have been replaced or are being held remotely. Some of obviously our clinical experiences have to be in person.
Right.
But I think you may see some smaller discussion groups, again, socially distanced with mass taking place in person, but it's definitely, hybrid at this point. But, we rotations, clinical rotations have to be done in person.
Do you want to say something about, I see that Captain Freeman has now joined us. Do you want to say something about the decision to change the name of Bard Hall?
Oh, yeah, I should. Yeah, thank you Steve, for bringing that up. Samuel Bard was one of the founders of the College of Physicians and Surgeons. He was a slaveholder. Bard Hall is named or was named after him. And after a review, the university has decided to remove his name from Bard Hall. That building will no longer be known as Bard Hall. We do not know the name of the new building yet, but it will be, it is now no longer Bard Hall. Bard Hall is primarily a residence hall for students, and university felt that it was particularly inappropriate for students to live in a facility who was named after someone who owned slaves.
So this is, I don't know, is it 60 Haven Avenue? So it's on Haven
It
Avenue.
is, it's 60. No, I think it's 40, but it's on Haven Avenue. I don't know the exact address of it.
Right.
So to me, it's just Bard Hall, but it's the building right next to the large towers. In
Yeah.
fact, you can access the large towers through Bard Hall.
Right.
It's a building that's been there since the 1930s. It was one of our original dorms.
Yeah.
But yeah,
It's just north of the, God,
the Kolb Institute.
yeah, right.
Yeah.
All right. Any other questions for Ross?
I just had a comment,
Okay.
if I could. I know Ross knows this, but just if other people don't, there is an effort to do a street co-naming for 168th Street between Broadway and Fort Washington, Healthcare Heroes Way, for the folks there at Columbia as well as New York Presbyterian. So.
Yeah, and Daryl, I think I thank you privately. I can just say that I'll say a public thanks to you and all who are working on this effort. Obviously, I'm biased, but I think this is very well deserved. Our folks were very much on the front line, and to receive this type of recognition, appreciation, I think will be will matter a lot to our folks. Will be very well received, and we're very, very appreciated by them.
And thank you
again,
for
thank
everything
you
you
for-
do. And that,
for doing this.
I just want to say that that'll be brought up at the Transportation Committee, Traffic and Transportation Committee meeting next month in
Yeah.
October.
The one thing I will say, I don't know, have you heard, is anybody else doing this elsewhere in the city? Near Sinai, near NYU?
I kind of heard something but I don't recall where that was.
Okay. Right. Again, thank you, Daryl.
Yeah, Daryl deserves a great deal of credit for coming up with this idea. Any other questions for Ross? Jay, do you have a question?
No,
Okay. All right, very good. All right, thank you, Ross. But let me just go back for a moment. But right now, the name is still on Bard Hall, is that correct?
I will be honest with you, Steve, I'm not on campus on a daily basis, so I don't know. I was there Tuesday, but didn't notice it. I will check. I'm going to be on campus tomorrow. I know that there will be an effort to remove it. I know that it's not as simple as just removing a sign. It's actually,
No, I think the name is chiseled into the building.
yeah. So, but it is definitely our intent.
Yeah.
I mean, it is no longer called Bard Hall, and we will be removing, any naming signs of it. It just, some of it is a, construction project.
Yeah. I mean, I think there are other things that have been named after Bard as well. I don't know if they're at Columbia, but is the Bard College named for the same guy?
I don't know that. I don't know.
Yeah. Okay. All right,
Steve,
very
I
good.
have a small comment about that actually it wasn't the university itself that came up with the idea to remove the name. It was a cardiologist at the university, at the medical hospital, I should say, that came up with a petition. And this is how, this is why the name will be removed.
That is correct. This was brought to us by one of our faculty members, and then the university acted upon it.
All right, very good. All right, well, you'll keep us informed.
Sorry,
You'll keep-
Steve. There's
What's
one
that?
more. There's one more question from the chat,
Oh, go
and
ahead.
that was basically just how often are Columbia Irving grad students tested for COVID?
Good question. I don't know the answer to it. I know we're all subject to what we call a gateway test, i.e. you can't come back until you have it, and then we're all subject to random testing. But I don't know the frequency.
Okay. All right, thank you, Ross. All right, Captain Freeman?
I hope you can hear me now, can you?
Yes.
Yay! Well, I have to apologize. I have been here for the whole meeting, but I'm sort of a Luddite. I guess I was a lurker until I figured it out. I was on my phone, and then I was on my laptop, and I finally got through on the department's computer. So,
All right, well, somehow you made it. As long as you made it before the meeting is over. So, Captain, as I told you before, we're very interested in knowing how our EMS unit has been able to survive through this whole pandemic, and how you've been able to handle it, and where you are now, and how the response times have been, because basically ever since the base station moved up to Washington Heights, the response times have been declining, and during this pandemic, I'm sure you suffered some setbacks, but maybe now you can tell us where things are.
yeah, and thanks for asking. We did better than expected. So just a quick history. We opened the station late in December of 2012 with 5 EMT ambulances and 1 medic ambulance. So that was 6 ambulances. They added 1 more medic ambulance in January of this year, and then they added another medic ambulance and 1 more EMT ambulance in May 3rd. So the facility was built for 6 ambulances, and we have 9 now. So presently we're at 150% capacity. So we got people everywhere. If you drive down to Amsterdam, I apologize. The city charter says that for every line ambulance that we have, and we have 9, we're supposed to have a spare. So that's 18 ambulances that we're supposed to park somewhere. And if I've got a couple broken down, I might have as much as 21 ambulances here. Right now, I've got about 12. When we started, we had 67 employees. Now, I think it's either 95 or 96 employees. About COVID, New York being the first infected and getting into this stuff early, we were as overwhelmed as the hospitals and the nursing homes were. We sort of had to go by the seat of our pants, and we learned how to treat these patients as we went along. So our protocols restrict us from positioning patients on stretchers for transport on their stomachs. And it turned out that with some of these patients, that was exactly the right way to do it. But it's you learn as you go. CPAP, positive airway pressure, good for some people with a bad case of the virus, really bad for some people with a bad case of the virus. So just like nationwide, as we've learned and our techniques have gotten better and we've gotten more equipment, we still have severe cases, but it's not as bad as it was in the beginning, this nightmare that was here in New York City. About Station 13, I had 90, I think I have 96 employees. Of my 96 employees, 34 of my employees got sick. That's not tested positive, that's actually got sick and missed work. The average was about 10 and a half days for each of them. That's 37% of our workforce. So it was pretty hairy. Because of COVID-19, we had 348 tours, 348 times when somebody's supposed to be sitting in a truck when they're not there because they're homesick. And the way it works is if I worked an 8-hour tour on an ambulance and my relief didn't show up, then I'm required to work another 8 hours. So many of our guys worked 16-hour tours back to back. You work 16 hours and either you drive home and go to sleep and drive back for the next 8-hour tour, or we had people sleeping in their cars and sleeping on cots here at the station. It was pretty crazy. Some of our guys worked 5 16-hour days in a row, 2 weeks in a row. So 5 16-hour days, you go home for 2 days, you work 5 16-hour days again. And all the people that were sick have come back except for one. We have a couple of guys who've been working for a couple of weeks, but you can still tell they're short of breath and they get tired and they have cardiac problems. These are young guys with no health problems before. We still have one guy out. Today's his 51st day out sick. Sadly, with the department, 2 EMTs committed suicide. They weren't from our station. They weren't from Manhattan, but it was kind of a depressing time. Our chaplain has just been great. We also have we have a peer group. We have a thing called CSU, which is a counseling service with psychiatrists and stuff. And so, I'm so proud of our guys because everybody came to work. Nobody complained. We at one point, nobody in EMS ever took the job to make a lot of money, and I think our guys knew how bad the community needed them. So we just came to work. At one point, I had 10 supervisors in February. I've got 9 now, but I had 10 supervisors in February. At one point, I think in late March, early April, all of them but one and me were out sick. So supervisors are just nuts too. We hadn't had any COVID cases in a couple of months. They told me today that they've transported 3 COVIDs today from our state this week from our station. I crunched some numbers. The first thing I did was first I have to tell you that these are just fire department 911 calls. I don't really have access to citywide to all the hospitals and voluntary units. So these are just department numbers and it's raw data. So it's close, but it's not, to the it's not perfect. And I compared month to month from 2019 pre-COVID to month during 2020. And even though I think the first really reported case was confirmed in 1st of March or the end of February. In January, the numbers from 2019 to 2020 were up 103%. In February, they were up 128%. and in March they were up 129%. So you can see it was climbing. In April it went to 118%. In May it went to 108. In June it went to 110. These are calls from our station. In July it was still up 108%, and in August it was up 106%. Steve, I've sent you all this stuff as all the actual numbers and stuff. But in August 2019 we had 2,343 ambulance calls here at Station 13, and in 2020 we had 2,482. So it's a 6% over normal. So then I went to citywide, the fire department ambulance calls, and compared them month to month. And it's different, markedly different. January of last year compared to January this year, calls were up 107%. It was the same thing in February, 107%. In March, it jumped up to 116%. But then in April, all the way down, it dropped. So in April, it was 86% of what it was in 2019. In May, it was 64%. In June, it was 77%. July was 81%. In August, it's 84%. So it's climbing back up to normal. And I have to assume, just presumably, it's because in Washington Heights and Inwood and Elmhurst were hot spots. We had many more calls than the rest of the city that were COVID related, and that starting in April, the rest of the city didn't want to go to the hospital because they didn't want to get the disease. Ambulance calls in the fire department, typically they grow by about 100,000 a year. It dropped in 2019 by, 10,000 calls or something. And this year, I extrapolated the numbers from August. It looks like this year it's also going to drop by about, 2019 we had 1,818,565 calls. In 2020, so far it's been 1,090,000. So looks like it's going to be about 1,400,000 or maybe 1,500,000. So that's also a drop. And I also think that's probably because of the people not going to the hospital because of COVID.
I don't know, at some point, it seemed as though all you could hear were sirens from ambulances going through our streets. It was amazing. The sounds of ambulances were so common going back a few months. I would have expected the percentages to be even higher.
Well, we had a lot fewer calls that were, somebody that has a sprained ankle or a toothache or, that kind of thing. So
Really? Wow.
those ambulance calls are, they only use lights and sirens when it's a priority 1, 2, or 3 call, a life-threatening call. Somebody's got a cut on their arm, okay, big deal. They don't go lights and sirens. But if it's a cut in their arm that's a bleed they can't control, or something like that, then it's lights and sirens. So yeah, all those lights and siren calls were life-threatening calls.
So they were COVID cases, no?
Yeah, mostly COVID cases and heart attack cases, which were, who knows what percentage of the ones that were called heart attacks in the beginning were actually COVID, COVID related.
Are you seeing an increase in calls for overdoses?
Calls for what, ma'am?
Overdoses, opioid abuse overdoses. I wonder how those have changed in the midst of this.
It's changed a lot. We had, in the beginning, we couldn't figure it out because, we get OD calls all the time,
Right.
and it slowed way down. And after about 2 weeks of it being slow on those calls, we figured out, well, the reason is that they can't get the drugs up here in New York. So they don't have the drugs to do the overdoses. But yeah, overdose cases are back up to normal. Our drug toxicity, alcohol toxicity calls are back to normal. And I think slowly the other, regular calls are going to get back to normal too. I mean, that's the way the numbers look, at least.
Yeah. So you guys are facing the same risk to personnel cuts that the rest of the city is, although your usage is much higher than the rest of the city. So are you concerned, like looking forward, what it could mean when across the board staffing cuts come through?
We, you know, it's always feast or famine with the fire department EMS because we have so many people that want to go to fire suppression. So
Right.
we can have a whole bunch of people, and then you know the fire suppression calls and takes 300 people, and so we're sort of used to that. I'm going to be subjective here rather than objective, but I'll give you my opinion on it. I think that it's mostly, I think it's bluff. I don't think it's really going to happen.
Good.
I think it's to try to get more money for the city from the state and from the federal government. But you know, I don't want to get political, but I would be amazed if they cut EMS, which you know Koch said wasn't an essential service. It's you know PD and fire suppression and sanitation. There's not that many of us. You know, I think the fire department employees, and it's less than 4,000 people. You know, and that's counting, you know, secretaries and bosses, not just people in the ambulances. I don't know exactly what it is right now, but I know that 4 years ago, I think there were maybe 750 ambulances total in the city. I don't know. It just seems kind of stupid to me if they're going to cut them, but you know, they're going to do whatever they're going to do.
Right. We also, just one question, not to, you don't have to address it now, but if you could think about it and get back to Steve and the committee. We're doing our expense and capital priorities, and you mentioned that you needed to have more capacity, which obviously you don't have, but if you could think about what your capital equipment needs are, what your personnel needs are, so that we can reflect them in our budget priorities, that would be very helpful.
I think that's probably above my pay grade, but I'll talk to my chiefs about it, and we'll get something back to you. You know,
Yeah, that would be helpful.
Physical plant is the physical plant. You know, I mean, I love the trailers that we have here, and I'm completely happy, and everybody is with them too. Eventually, they will build a real state.
Yeah, you need a real building. I don't know how you can fit 96 employees into that space that you have. That's well, they're mostly out in the field, of course, but the last time I got a 2-minute tour, there's hardly any locker rooms or anything. I mean, God, it's you know, pretty small area.
Yeah, we don't have enough lockers for everybody. So you know, we have people doubling up on lockers. Not a lot, but some. You know, we're happy. We adapt. Everything's good. You know, don't worry about us. We're doing just fine.
Well, as long as people are, I don't know how they survive doing 5 days of 16-hour tours. That's incredible.
Well, that's not, you know, certainly that's not everybody, but I know that everybody had to do at least 1 or 2 more double tours a week there for a good couple of months.
Wow. All right.
I just had a question.
Yeah, and then I'll call upon Jay.
Oh,
Go
okay.
ahead.
Yeah, no, I mean, you know, and I think Sally touched on this and you really answered as best you could. But there's a question in the chat, you know, as well about personnel cuts. And hopefully that does not come to pass, you know, as it relates to EMTs and fire. But the other question someone had was how you basically, you know, treat someone who is undocumented as it relates to the services that you all provide.
We treat them like anybody else. You know, the golden rule here is that you got to treat every patient like your family. So if they're undocumented, they want to give us their name, they give us their name. If they're undocumented, they don't want to tell us where they live or anything, you know, we take them anyway. So does that sort of answer the question, or am I off track?
I mean, maybe they could say in the chat if that answers the question, but I think it does.
Listen, I mean, EMS is not, EMS is just checking on your health status. They're not checking on your citizenship status.
Yeah. We all bleed red.
Okay, Jay, you had a question?
Yeah, yes. I was wondering, the 96 workers you have,
This is Fabrice.
what specific job titles do they have? Is turnover still a problem, either because of low pay or people going on to the fire department? And how are you dealing with those questions? Also, how many people are assigned to each shift? And what are those hours?
Okay, so we have staggered hours so that when it's shift change, you know, it's not like at a factory where everybody goes home at 3 o'clock and the new people come in. So we have units that go out at 6:30 in the morning, at 7 o'clock in the morning, at 8 o'clock, at 9 o'clock, at 7:30, and then units that go out for the evening shift at 6:30, 7 o'clock, like that, 9 o'clock, 10 o'clock. The majority of the people here are EMTs. I'd say more than probably 3/4 of them are EMTs. The rest are paramedics, and then all my officers are paramedics. But I have 9 officers plus myself that are here. That you see the ambulances, then you see those red trucks that drive around. Those are our patrol supervisors. Those are lieutenants or me in the truck. As far as overturn, that's been a recurring problem since Health and Hospitals went to the fire department back in the 90s. It's something that happens, and they open up hiring. It's getting better now because it used to be easier to step up from being on the medical side to go to the fire suppression side than it is now. It's open competitive is the way to go. So that's going to fix itself. Yeah, the pay's low, but like I said, people do it anyway. And I whenever I talk to people, most of them say, "Well, I thought this would be a fun job. I'd do it for a year or two and then do something else." And then you turn around and you've been here for 20 years.
All right. Fun job. God, it's got to be. I would think it's got to be one of the most stressful jobs. Any other questions? Darryl, what does this mean? I have a hand with a number 2 next to it. Is there someone else raising their hand?
Yeah, it looks like 2 people. One was Jay. So
I'm trying to unraise my hand.
Hold it.
Oh, okay, that's fine.
One second.
And
We
the
have-
other is
We have
Fabricio.
Fabricio Caro. He's is he a panelist? Fabricio, can you speak?
Do you hear me, Steve?
Yeah, Fabricio is the Director of Community Affairs for the Fire Department.
Yeah, so good evening, and Captain, thank you for presenting this evening. There's one thing to add on, I think, and the Captain highlighted it well. I mean, I think right now, regarding staffing and the doom and gloom with the budget and the talks of potential layoffs, I think right now there's a lot of uncertainty, and I don't think right now what's been being portrayed on the news, ultimately in the media outlets, I don't think we have at this point a concrete idea. I mean, the one thing that I can say that the department does have, even with the budget reductions that have been planned, are intact numbers for EMS training. And there is an outlook or a positive outlook of remaining or maintaining some level of EMS training, meaning that we are, as a department, going to look out and provide EMTs into the workforce within the coming years. Again, with any type of layoffs, and whenever that is determined, there is going to be some level of impact to service. But I think at this point, it's too early to determine what that number would look like, if it's going to happen, and exactly what that would incur in terms of overall operations. So I just wanted to add that piece to what the captain had mentioned. Steve, I know that you had a couple questions regarding fireworks. I don't know if you wanted me to get into that.
I'm sorry, a couple of questions on what?
On fireworks over the past summer?
Well, actually, let's finish first with EMS, and yes, I do want to talk about fireworks.
Okay.
But Captain, did you have anything else to report?
Only that I hope.
I think you said that you sent me some statistics.
Yeah, the stuff that I was rattling off to you, I have all that on graphs that I just sent you as an email while I was trying to get to talk to you.
Oh, okay, great.
So that-
All right, so I can incorporate that into the minutes. Okay, are there, and are there any other questions for the captain? Well, I tell you, Captain, I just want to, I think I'm speaking on behalf of the entire community board to express the appreciation for the devotion and the work that was done by EMS during this entire crisis, for the work that you do overall, but especially the work that that you did during that you've been doing during this pandemic. It's just been amazing, and whenever any discussion comes up about essential employees or frontline employees, you guys are absolutely on the front line. You're on the first of the front lines.
Well, my answer to that is, oh shucks.
All right. Well, I'll put that in the minutes. All right. So if we're finished now with EMS, and Captain, I do want you to come back from time to time and give us updates. So I do appreciate you being able to give us some time tonight. Fabricio, the fireworks issue is really, maybe it's plagued the entire city, but it's also been plaguing our community going back to maybe the end of May, early June. We were just besieged with fireworks every single night, unrelenting till, I don't know, 4 or 5 in the morning sometimes. People couldn't sleep. It was just all over the place, from one end of Washington Heights to the to the tip of the island, including Inwood. So what I'm interested in is, I want to do a resolution, in this committee and in our public safety committee, urging the city to take stronger action next year to prevent a recurrence of what we went through this year. But what I want to know is, I know of at least 2 instances where these fireworks set off fires. And in one case on Nagel Avenue, a family was burned out. In another, and actually on the very same day, on the early hours of July 5th, right after the midnight of July 4th, they were burned out on Nagel Avenue, and an apartment on 157th Street. Fireworks were set off on the roof. The roof set on fire. The 6th floor apartment also went up in flames. They didn't suffer maybe as grievously as the people on Nagel Avenue, but they couldn't get back into their apartment, I believe, for at least 10 days or so. And then we have at least one case where a daughter reports that her mother suffered an anxiety attack, then a heart attack, and then died, all because of these fireworks. And people think they're having fun. This is not fun. This is a really serious issue. So what I would like to get from the fire department is how many other instances might have occurred during this period in our community where fireworks created fires, where people who didn't give a damn where they launched these fireworks, if it ended up in somebody's apartment or somewhere else, did it cause fires that your guys then had to put out?
So Steve, just to answer your question, I mean, again, in speaking with our Bureau of Fire Investigation, again, they investigate, and the only fires that we investigate is based on the severity and also in terms of any fire injury ultimately. In terms of the ones that did get noted,
I'm losing you. Hello?
That were referred by to the Bureau of Fire Investigation, the only one up on our record right. You hear me now, Steve?
No, you're not quite.
Hello.
Hello?
You hear me now, Steve?
Now, yeah, go ahead.
You hear me now?
Yes.
Okay, do you hear me now?
Yes.
Okay, came within our scope as the 184 Nagel Avenue that occurred on July 5th in the early morning, where it was on the first floor apartment, where ultimately, there were two minor patients reported, both non-life threatening, but the cause was because of the use of fireworks. However, the department, in working with the sheriff's office due to a mayoral task force, due to the severity of fireworks over this past summer, which spanned from early June all the way up to July 4th and a little bit beyond that, basically established a group to target seizures or to target the distribution, ultimately to seize large-scale fireworks distributors. Ultimately, beyond that, the department did take proactive measures in terms of developing public service announcements in various languages and public outreach utilizing firefighters to table with inset communities based off 311 data that rated certain communities as having the highest rankings of fireworks complaints. We sent firefighters into those communities to table, to distribute the dangers of fireworks and the illegal use of fireworks. And it's something that we saw somewhat help as a preventive measure, but again, I think it's more along the lines of enforcement, of really having to deal with the measures of tackling those that do use fireworks. The fire department in the coming years will continue to do tabling right around or prior to the 4th of July weekend, where we do see typically a spike in fireworks, but specifically in the zip codes of Uptown of Inwood, Washington Heights. The only ones that we can say that were caused officially by fireworks within our records, granted, there might have been smaller incidents that may have not been reported out and investigated due to cause, but the only one that we have was on the 184 Nagel Avenue, which was on July 5th.
You don't have a record of the one at I think it was 551 West 157th Street?
I could look at it, but from what I got from our assistant chief of fire investigation, the only one within the zip codes you provided was 184 Nagel Avenue.
Well, let me tell you, that one was bad enough, because that, from what I understand, that entire apartment got burned out.
There were also fires in parks. We had fires in Inwood Hill Park that were caused by fireworks. But it's at a different set of.
Steve, I have my hand up in case you don't notice. Thank you.
Oh, yeah, okay. All right, well, go ahead, Tanya.
Yeah, I just had a question for you. I wanted to just ask, why do you think this was so much more extensive this year? What was the cause? And do you anticipate this being the same case next summer? And what is there any, I know you talk about your plan, which is, trying to stop distributors, but is there anything that can be done? Because this stuff finds its way into this community all the time. And so what can be done even once those illegal fireworks get into the community? Is there anything that can be done? But first, I just want to know, why was this so horrible this year, and what can we expect next year? Because some people were saying they're going to move, or people were saying, well, I know I couldn't live here. I had to escape to somebody's house because I could not sleep, and that, so I just wanted to know, if you could just answer that. I'm sorry, I don't mean to throw so many questions at you, but yeah, just that, yeah, if you could let me know that would be great.
Yeah, Fabricio?
Yeah.
Fabricio, are you still with us?
No. Yeah, no, honestly, and those are great questions. I don't know if I would. Yeah, do you hear me?
Yes.
Yeah, do you hear me, Steve?
Yes,
Steve, do you hear me?
Yeah, I can hear you now, yeah.
I apologize. I'm on Fort Taunton campus in Queens, and I have poor service. But what I was going to say is that, those are all great questions. I mean, honestly, from a subjective standpoint, and, again, this is my opinion as well, I generally, this year, I think, was a bit different from previous years just because of everything going on with the quarantine and COVID, ultimately hindering outdoor public events and possibly the distribution of fireworks in other states and across the states, I would say, that you did see a mass distribution ultimately on an illegal sense across neighborhoods across the US. Typically, you do see a spike in fireworks use and illegal fireworks use as you draw closer to the 4th of July annually. But I think this year, just with COVID-19 and the quarantine and a lot of restrictions in overall distribution or access to, hold on, I'm sorry, hold on a second.
Yeah.
Sorry, apologies. I think beyond just what was going on with COVID and the quarantine, that could have exacerbated a lot of the issues as well. Again, in terms of how to prevent it in the following years, I think it's all about the work of combined task forces in terms of enforcement, similar to what was done this year with NYPD, the Sheriff's Office, and the Fire Department, ultimately working collaboratively to tackle the distribution levels. I think on an enforcement and looking on a more local level, working with local fire units and NYPD precincts to respond or monitor quickly more to incidents or reports of fireworks with certain communities. And I think it's all about public education as well, and working with community stakeholders like the community board and other tenant organizations of really educating in advance of these periods where we do typically see a spike in firework use, and just basically educating communities to the dangers of fireworks and what can occur. And clearly, we've had set examples, as mentioned with the fire in 184 Nagel, where property has been lost and people injured, and to several other instances that were mentioned earlier on the call. That there's a clear danger when people do use fireworks in an illegal fashion.
Do you know if anybody? One second, Tanya. Do you know if anyone was arrested as a result of that fire at 184 Nagel?
I don't know if anyone was arrested. I can look into that with our Bureau of Fire Investigation and follow back with you, Steve. And I'll actually look into the other incident. But again, when I spoke with them this morning, our Bureau of Fire Investigation only said that the only one reported that there was an investigative report on was 184 Nagel Avenue.
Yeah, but I think I'd like to know whether anyone got arrested. I'm sorry.
I can follow up on that.
Okay. Tanya, did I cut you off?
No, it's okay. Yeah. I just was a follow up. One of the things that happened is that at first people were saying we were told to call 911 when we saw illegal firework activity, and then they cut that off, I guess because they got so many. And I don't know if you're aware, but in our community, we had on like 5,000 illegal firework complaints or something like that. It was very high, and it was higher than all of the other communities in all of Manhattan up here.
Right.
And so obviously there's something specific going on up here that was kind of even more problematic because to have numbers that high, but we were that switched on us. So we were first called, they were told to call, when you would go to 311, it would say call 911 for illegal firework activity. Then they cut that off. So it seemed like in the middle of this crisis, we were sort of left spinning because the avenues that were set up for us to do this were sort of cut off, right? And so we just sort of suffered in silence or tried to escape. So I just want to know what is it that you would want what avenues, what resources are you all going to have for the community to use to address this in the future? Because I just see this happening again, and I don't want to be in the middle of a crisis and not have anywhere to turn like we were in the middle of this year.
So those are all good questions. Again, I think it's all about the preventive measures beyond just enforcement. I think it's a combination of both. On the enforcement end, I can tell you that with the examples done this past, or with the issues that occurred this past summer, interagency and interagency collaborative work will continue into the following years, and FDNY will continue to work with NYPD and the Sheriff's Office per the direction of the mayor. In terms of prevention and working on the education front, I think it's just working collaboratively, knowing that the spike usually does occur in the month leading up to the 4th of July and around that time, I would say proactively working with, again, the community board or community-based organizations and getting out and doing education ultimately to showcase the dangers. Now, in terms of other ways of basically reporting or using an enforcement tool, I would stand corrected with just saying that 911 is the only number. You know, the fire department does have an FDNY fireworks enforcement unit, which anyone can call and report illegal use of fireworks to, and it will be inspected and investigated. And that number is 718-722-3600. Again, 718-722-3600. And that's basically to report the illegal use or report of fireworks within a community, and our Bureau of Fire Investigation will look into it. Again, you know, this year was a bit challenging just because of the overwhelming nature in certain communities, as Uptown Manhattan did suffer with a spike in those incidents. You know, we did see other spikes in other communities as well. I know in Central Brooklyn, it was another community in the Bed-Stuy and Crown Heights region where I think it was either the second highest in the city that we were getting reports of fireworks complaints. So again, just to reiterate everything, I think it's all about early education, and again, having and continuing to work with law enforcement and fire protection services ultimately to tackle this in advance. But, you know, rest assured that we are going to be working within the coming years and year, given this circumstance that we just experienced, of really tackling this issue, because it's not only the distribution and tackling those that distribute, but at the end, but it's also about educating the community of how to basically report and teach of the dangers, so that, you know, this message is loud and clear.
Yeah, I have a question.
Well, one second. I think there are 3 hands up. Is that? Oh shoot.
I think Jay's is still up, unless that's new.
Yeah,
And
I thought I saw Natalie Espino.
She withdrew. She took her hand down.
Okay.
But my question was, so do you go out into schools and talk about your work in general, right?
Yeah, so fire safety education is not only fireworks, it encompasses all levels of residential fire safety. And yeah, we do go to schools and speak about
I just want to make sure fireworks was part of that. That was
yes,
really.
so fireworks, if you look at, and we have brochures in different languages as well. But fireworks, yeah, I mean, we do cover fireworks within our fire safety plans and fire safety lessons as well.
Okay. All right. Well, I tell you, Jay Mazer is back. Jay, do you have a question?
Yes. I think the main cause of the end of the fireworks epidemic was that the legal manufacturers and the legal distributors sold out the merchandise rather than any efforts in either public education or enforcement. And I rather suspect if the supply was still available, we'd still have the problem in September.
Okay. Well, yeah, I think I mean, maybe Fabrizio would agree. I think there may have been an issue or a contributing factor in the fact that maybe there was an abundant supply of fireworks, because a lot of regular fireworks events were not taking place. So maybe is it correct to say that the fireworks wholesalers had a supply they had to get rid of? I mean, is there any credence to that? Do you
I mean,
think?
that could be. I think it's with the quarantine and everything that COVID-19 impacted on overall business and distribution of materials. Again, I think when you talked about the illegal distribution, because again, the use of fireworks varies from state to state. So again, how things are distributed, how are sold is going to affect differently across the board. And I think just because of potential surplus just be due to the quarantine and everything like that could have, you know, caused it. But, again, I'm not going to just speculate on that. I think just as a whole, it's an
Okay.
issue of distribution that occurs from year to year. And again, the spike usually is seen right around the July 4th time and leading up to it. So.
Okay, does Richard Allman have a question? His hand is raised. Is it possible for Richard to ask a question? He's not Chanel, can you make him a panelist? How does Richard Allman get to ask a question?
He could also type it in if we can't promote him.
Hello.
Richard, go ahead.
First, just a very brief comment. What Steve just had to say about the fireworks supply and its impact is the one thing I've heard most consistently about fireworks problems this year, and at least I take that very seriously. My question would be to Mr. Carroll, having just mentioned the fireworks enforcement unit, the department's fireworks enforcement unit, how can we engage with them in the planning process and everything that happens from now till this time next year? I'd like to see us have more options than just we can make a phone call some June night when things get bad. And I guess the second part to that question is, in doing that, how could that also be coordinated with similar units in the police department and perhaps other departments?
Well, I mean, I can't speak in regards to NYPD, but with FDNY, I could say, that's a simple conversation in terms of just planning and preparing for the year to come. In terms of connecting with that specific task force of the unit in advance, I'd be more than happy of coordinating it. But I would also, from a departmental standpoint, also bring in the outreach and public education units, just because I think beyond understanding the task force and the enforcement aspect from the department standpoint, I think we have to think of it from a holistic approach of not only enforcement but education as well. So trying to combat this epidemic from all angles.
All of that's fine, but having worked on outreach and communications issues myself, I want to make sure that the onus isn't placed entirely on the community to fix the problems and to be better educated. It's on both ends.
Oh no, completely agreed, and I think
All right.
collaboratively that's what needs to occur.
Okay, I tell you, Fabricio, I want to have a conversation with you offline to pursue this further. So I'll be giving you a call.
And thank you, Steve.
What's that?
No worries, Steve. I'll be more than happy to work with you.
All right. No, I know that.
And
I appreciate your efforts, and we need to work with you on this because we got to come up with some kind of a solution. But
Steve,
we
and
gotta
there was also something from the chat
Yes.
about the use of sound cameras. Is that something that's possible for enforcement?
I could check with our Bureau of Fire Investigation. I mean, I have not heard of sound cameras necessarily. I'm not
Yeah,
familiar with it.
I have some material that somebody forwarded to me about this, which I can send on to you.
Send on to me, Steve. I'd appreciate that. I can check with our Bureau of Fire Investigation, and then I could circle back with you guys.
Okay, very good. All right, thank you, Fabricio. You were unexpected and a very valuable guest. Thank you so much.
Thank you, Steve. Thank you, everyone.
All right, back to our regular agenda. Is Betty, do you have a report about Isabella? Betty Lehman.
I'm here. Hi. Yeah, I do have a report. Isabella has, come through some challenging months in the spring, as you may remember. We are fortunately in a situation where everything is under control. We follow all state and federal guidelines for infection control.
Having trouble hearing you.
Can you hear? Can you hear me? Can you hear me?
Can you get closer?
Can you hear me now? Can you hear me now?
Yes, yeah.
Okay, sorry about that.
And if others could mute, that'd be great.
All right, Isabella has been and continues to follow all state and federal guidelines for infection control and for testing of staff and residents. All staff coming into the building are interviewed every day or given temperature tests every day. Anytime they come into the building, also they are tested with the nasal swabs on a once-a-week basis. And those results come back pretty quickly so that we are able to maintain control of our staff in terms of infections and so forth. We do have sufficient personal protective equipment called PPE, according to our DOH guidelines. And as you remember, that may have been a challenge back in March and April, but we do have secure funding sources and supply sources for that equipment. We are going to seek funding for supplies and for programs and so forth. You probably know from the press that a lot of effort has been put in by the medical community in general, as well as state and federal, state and local governments to secure funding for various services. And we're part of that. With regard to our residents in the nursing home, we have two efforts that are underway and have been for some months now. We have a hotline for family. Visiting has been restricted since March 12th. We do permit window visits today, or have been for the last couple of months. And what happens is the families will arrange with the social worker for a time and a date where they will come in, and then we bring the resident down into an area on our first floor where obviously we have windows, and we're able to set up a window visit with the family on the exterior of the building in a protected area, and then the resident inside the building. Those visits are arranged in advance, and they're typically of a half an hour or maybe an hour of duration, depending on the situation. And that's been going well. We also have a hotline for family members, any family member to be able to call in and get the status of their loved one on a daily basis. That particular hotline is manned by social workers who are able to address the issue promptly and appropriately to address the family member's concern. We also have our community-based programs, our Senior Resource Center, our North programs, and our Upper Manhattan Partnership for Senior Independence. Those programs continue to function. They are being handled on a virtual basis in many cases, although in some cases we're able to go to visit people now in their homes to be able to make sure that they're okay. Obviously, they have the right equipment in terms of PPE and et cetera. So we're carrying on as best we can. It's an ongoing effort, as you can imagine. Like the medical community at large, we do not know what the fall will bring. So we're, bracing for hopefully a non-event. We don't know. But right now we're holding firm, and we're very grateful for the support we've gotten from the community in terms of people offering to help with providing masks and providing other kinds of support. So we're very happy and very grateful for that. And our employees are very happy as well. We did have, as you know, we had 3 deaths among our employees in the springtime. Fortunately, everything is fine now. Nobody has died recently, which makes us happy. And that's about it for now.
And I'm sorry, Betty, did you finish?
Yes.
All right. You'll be able to send me that report so I can incorporate it into the minutes?
Yes.
All right, so I'm looking at the State Health Department report that came out yesterday with statewide data on nursing home and adult care facility COVID-related deaths. And the numbers for Isabella, they look the same from the last report I looked at maybe a couple of months ago. So it doesn't look as though it doesn't look as though the COVID has continued to really cause additional deaths at Isabella. Is that the case?
That is the case. So because those numbers have to be updated on a daily basis. Well, we provide the information on a daily basis. New York State publishes, I think, on Sunday night.
Right. So, I mean, you hit that high point a few months back, and then now it seems to have settled down.
Yeah.
Okay, well, that's good news. All right. Are there any questions for Betty?
I had a question. Aren't congratulations in order, Betty?
What?
You're the new assistant chair of this committee.
Oh,
Congratulations.
congratulations or condolences, I don't know. Okay, so
Yeah, well, she's
I defer to our fearless leader, Mr. Hyman here.
well, she's got big shoes to fill. What's your shoe size, Darrell? Any real questions? All right, very good. All right. Is the New York State Nurses Association with us?
Yes, we are here, Steve.
Yes, we're here. Yes.
Oh, very good. Julia, did you want to say anything, or should we go to straight to Alana and Christopher?
We have Christopher here with us, and he's going to give an update on what's going on with the Allen site.
Yes. Yes. My name is Chris. I'm one of the nurses at Three River East, which is the psychiatry department at the Allen Hospital. So we had a rally back in August, which was really successful. We had a lot of representatives, a lot of people of the community. You know, despite the rain, you know, every year it always rains. We have a rally, it always rains. But yes, despite the rain, a lot of us showed up and still supported us, which was great. Yeah, the Allen is still closed. The psychiatry department is still closed. You know, despite all the room up there on the third floor, the only, you know, half of the unit, third floor is for doctor offices, outpatient doctor's offices. Our wing at the Allen is still empty. Psychiatry is still empty, and there's the OB department. And you know, we're still the floor is just completely empty. They'd rather have it empty than take our psychiatry patients up there.
There was I'm sorry, Christopher, are you finished?
Yes. Yeah.
I just want to add, sorry, I just want to add, Steve, that Chris mentioned that the psych nurses are actually doing COVID testing. They're in Milstein right now. And, you know, last time we said that they're doing orientation, med-surg orientation in all the different floors of the Allen. But now, according to Chris, they are assigned to do COVID testing at the Milstein Heart Center.
Correct. Yeah.
So, yeah.
Yeah. So far, I mean, the executives from the hospital, they told us that we're still temporarily closed. They won't give us date. They won't give us time. They rather have it closed. They moved us from med-surg, where we took care of, you know, the patients in the community. There was a lot of psych patients there as well. I worked on both med-surg floors, and out of just say 24 patients, 6 of them on each floor was psych. They had them on 1-to-1, which is constant observation, and they were pretty much kept in their room, which is pretty cruel, you know. If we had the psych floor, usually they were allowed to go to groups, you know, with a therapeutic environment. But since they were psych on a medical floor, they were kept in the room all day with nothing else to do. And
so well, that's interesting. So we're talking now about psych patients were mixed in with the rest of the inpatient population at Allen while the psych unit has been closed. Is that what you say? Is that what I understand you to say?
Correct. So what happens is sometimes the psych patients at the Allen are maybe they're diagnosed with other diagnoses as well. You know, sometimes cardiac issue, they have other issues going on, but we do have a great deal of psych patients on the med-surg floor, which takes up room for the medical patients as well. You
Okay,
know,
normally, if the psych unit was open,
Right.
that would not be the case. Is that correct?
correct. All the psych patients would go up to us, even if they had medical conditions. We're able to handle them on our floor.
Okay, and so and in this case, though, the psych patients were still admitted to the Allen and were not sent to Gracie or Westchester or to another place. They were still sent to Allen, which maybe suggests to me that that there's a need for these beds at Allen because the population can't be served elsewhere. Am I on the right track?
You're on the right track. Yes, sir. There's such a, I mean, there's shutting down beds everywhere. I mean, Gracie Square. Last I heard that the third floor, they have 4 floors. One floor is completely down. Brooklyn Methodist is closed still, and here at the Allen, we're still closed. So that's
and how many psych patients could you say have been in the med-surg beds at Allen? Is there a way to?
I worked on both floors on med-surg at my time there, within about 8 weeks there, 2 months. So I would say about 6 on each floor. So that's 12, and each floor maybe has about 30 patients. So that's about 20%. Of the beds, and of the med-surg, and then they're taking up med-surg floors, so med-surg beds as well.
So 20% of the med-surg beds were occupied by psych patients. Okay, well
I believe so.
okay. That's a good piece of information. All right, I'm going to step away for a moment. There was I want to pull. There was an exchange of correspondence between State Senator Jackson and I believe some other elected officials and Dr. Corwin, the president of the hospital. And Corwin wrote back, and I think once again, if I'm correct, did not make a clear commitment about restoring the psych unit. I mean, they still talk about how they're not prepared to reopen the psych unit at this time because of the possibility of a second wave and how they're going to need these beds again for COVID-19 patients. But if I remember correctly from that letter, he still doesn't make a clear-cut commitment to live up to the requirement to restore those beds once the COVID-19 crisis hopefully goes away. Julia, are you familiar with that letter?
Yes, I am. And I think I did, at the last meeting, I did send you by email a copy of the response from, the letter to Dr. Corwin. And I can resend the response, which is basically a non-commitment of reopening the psych unit. Exactly what you said, Steve, that, they don't know, they have to play it by ear because there may be a second surge and they may need that unit for COVID patients, etc. So I just wanted to mention that first of all, I wanted to follow up, Steve, because you said that because in 2018, we were able to put together a resolution, right, that was passed by CB12 regarding the Allen psych. And we don't need to do another resolution, but instead you're going to be sending a follow-up letter. So I don't know if you were able to do the follow-up letter to Dr. Corwin, or should we be working on that?
Yes, we should be working on that. I dropped the ball. You're absolutely right. I did intend to do a letter, especially with when the elected officials did their letter. I wanted to do one for the community board. So yes, I do want to do another letter. And I now have I'm now holding the letter that Dr. Corwin sent back to State Senator Jackson, where he says, I very much understand the desire to know when those inpatient beds will return to Northern Manhattan. At this time, we are undertaking a thorough evaluation of our behavioral health inpatient capacity and outpatient services at both the Allen Hospital and our Milstein campus, so we can determine a comprehensive plan that best meets the behavioral health needs, including inpatient beds of the Northern Manhattan community. We will reach out to discuss and work together with you and our other government and community partners on that plan in the fall. Without knowing with certainty whether there may be another surge, we know we need to remain flexible with our physical spaces and resources for the near term. We also must provide these important services to residents of this community. Well, that's maybe more than he has said in the past, but I do want to see how he intends to work together with us on this plan that he's talking about. Darrell, go ahead.
Yeah, I just wanted to ask a few questions from the chat. I'm sorry if you may have answered some of this, but there's 3 questions. So one, for the folks at New York Presbyterian working in psychiatry and mental health, has the pandemic had significant effects on the number of in or out patients the hospital has been treating? Has there been a surge or a decrease lately, or have the numbers stayed constant? Did you want me to ask the other questions, or do you want to answer that first?
Well, I don't know whether, I think the only person who might be in any position to answer would be Christopher, if, but I don't know, Christopher wouldn't really have that kind of.
Yeah, I can say from my point of view, I believe that, I worked on med surg floor. I would say COVID patients, we always rule out COVID patients. When patients come in, we do a swab right away from the ER until they're confirmed that they're COVID negative. They're always treated like a COVID positive patient. So they're always in an isolation room. They're always on, we always wear our PPE when entering. We take all precautions necessary, just like if they were a COVID patient. Once they are COVID negative and proven with the swab, with the results, then we put them in a combined room. So I hope that answers that question. Maybe there's about one or two COVID positive on a given floor at any time, I'd say.
Yes, after that, I could see.
So the numbers greatly decreased when I worked at Gracie Square, when they sent us first to Gracie Square, where the whole floor was COVID, or at Allen, where the whole floor was, all COVID. I feel like the numbers greatly decreased since then.
I tell you, I'm sorry, did I cut you off?
Yeah, and are there demographic stats for patients being treated for mental health issues?
I don't have stats. I probably, I don't know how we can get that, but.
No, well, that's information we should request from the hospital. But I tell you,
lastly, is anyone being actively turned away from Allen?
Actively, well, I know that the psych patients, I've seen on med surg, when I'm on the med surg floor, psych patients are getting discharged a lot quicker. I don't believe they're treated, fully at 100%, and they're discharged a lot quicker than they would on our Three River East floor. They get more resources at Three River East. Maybe they get, they're discharged to a social worker, or, maybe a rehab, or, they're waiting for a rehab, or even we wait for state beds for them. On med surg floor, even they're just discharged pretty quickly. They're just treated quickly, maybe just not at 100%. I even asked about treatment over ejections. Patients that aren't in the mental state of mind, that need IM, intramuscular injections over their, against their will, basically, which is usually court ordered. It's ordered by the Department of Health. They have to go to a judge. They hardly do that. So they're just pretty much you know, they don't do that at all. So they may not be discharged at full efficiency. Does that answer your question at all? I'm sorry.
It wasn't
Yeah,
mine, but
well, I think I think the kind of information that's being requested here is really beyond your ability to provide, and is information that we would have to ask the hospital to give us. And I tell you, at this point, the hospital has not exactly been forthcoming in providing us with information. I can't tell you how upset I feel with the hospital at this point, because I've asked over a period of months for information on the number of COVID patients that have been treated at the Milstein and at Allen and at the Children's Hospital, at the facilities in Washington Heights and Inwood, and they refuse to provide the information. It's unbelievable. You'd think they would want to impress upon us how much work they're doing and how they're dealing with this crisis, but they will not provide simple statistical information on the number of patients that they have been serving, who have been admitted to the hospital, the number that have been discharged. I asked how many patients are in the hospital today with COVID-19 COVID-19 symptoms, and I can't get the information out of them. To me, it's mind-boggling. There's just no explanation for why they're not being forthcoming and providing just basic information about the services they provide in our community. I'm not feeling too positive right now about our ability to get information from the hospital.
I have a question.
Yeah, Sally.
Okay, yeah, just to, Chris, just to review some of the data that was given out that you mentioned today, and it was also at the rally. So we've got the 52 units at Brooklyn Methodist they're now gone. The 25 beds for the same reason, COVID capacity, reserving them for COVID capacity. And then the other 25 for some sort of renovation that they say they're doing. There's one floor of 4 at Gracie.
That's Gracie Square, correct. That's the third floor. The third floor.
Do you know how many what the total bed count is at Gracie and how many beds that would represent?
I'd estimate. I mean, we were there for a while. They usually have about, I'd say, 30 beds a floor.
Okay, and then at Westchester, because what they told us originally was, well, the patients are going over to Gracie, they're going to Westchester. Westchester's also closed down capacity in terms of chemical dependence and maybe even some of the psych. Is that true, or am I understanding something that I should probably misunderstand? Or am I misunderstanding something? Have we lost capacity in terms of services at Westchester?
I'm not aware of Westchester.
Okay.
But from what I know, aside from the Allen, New York Presbyterian Allen, the Methodist,
Right.
New York Presbyterian Methodist in Brooklyn, Northwell Syosset in Long Island,
Okay.
Northwell Health Methadone Clinic in Brooklyn,
Okay.
New York City H&H, North Central Bronx,
Right.
and also Westchester Medical System. It's called the Health Alliance in Kingston.
Okay, great.
And actually, thank you for bringing that up, Sarah, because looking at the bigger picture, we actually have a campaign, Save New York Psych Beds. It's a statewide campaign, and because there's all of these units that are closing around all different hospitals, and we want to build a coalition that will include more community organizations, and we would like to invite CB12 to be part of this coalition. As we know, the hospitals are still hiding behind the excuse of COVID and whatever COMO will be mandating if we have a second surge. So we want to start calling out the DOH and the OMH because they haven't done anything, They're actually being very silent and allowing the hospitals to get away with all of this. So this is an invitation to CB12 to be part of that coalition and to help us, if you guys can help us identify in Washington Heights community other organizations that we haven't engaged with regards to fighting to reopen the Allen Psych unit and, you know, the New York State psych beds in general. We would love to get assistance so that we can reach out to them also.
Great. Yeah, I would like to, there's a couple organizations I work for that would be happy to join the coalition. The other question or comment is for Steve. The world has changed dramatically with COVID. I think rather than a letter, I actually do think we should consider another resolution. Basically, we know that the need has gone up with COVID. We know that we have this pent up demand if we ever get through this, but there are many people that in other times would have necessitated inpatient treatment that aren't getting it. And I think that we need to emphasize that and focus specifically on the failure to address this need. So I think the community board and this committee should consider another resolution that builds on our first resolution, reiterates a lot of those points, but also addresses the fact that the need is greater than it was when we originally focused on the Allen. So just my 1 cent.
Okay. All right. Point well taken. All right. Anything else for Julia or Chris? All right, Julia, I'll be following up with you, and Sally, I'll talk to you a little bit more about what you just raised. Okay, very good.
Thank you, everyone.
Okay,
Thank you for your time. Thank you.
Okay.
Thank you.
Hey, Steve.
Yeah.
Can I just ask a couple things or mention a couple things?
Okay.
One, just a gentle time check. It's 9:15.
Yes.
Two,
yeah.
Two, Betty, for your report, I missed a question. I'm sorry. So the no patient currently has a resident currently has COVID at Isabella. Is that correct?
That we know of. You know, every day you've got to be very careful to check all the time. So we monitor it closely, but right now we're good.
And then also someone asked a while ago about enforcing masks, you know, at restaurants, especially on those larger corridors like Dyckman. Really, the police aren't coming. I would say this is my answer, but that 311 would be your best bet, unless other folks have other answers.
No, I think you certainly should begin with 311, and those apparently those calls are not being referred to the police. That's no longer, if it was at some point a function of the police, it's now being handled through the mayor's office of enforcement. So you could certainly file a report through 311. All right. So what do we still have hands up?
Sally, is your hand up for some reason?
Oh, I need to lower it.
Okay. And Richard, do you have a question?
That's from quite a while ago.
All right, very good. Okay, all right. Well, okay, we're now on to our follow-up on the noise pollution hearing that we held back in early August. Claudia Scher, the founder of the website, well, is it a website, a social media group of Wahai Inwood for Respectful Decibel Levels? Are you with us?
Yes, hi. Thank you so much for having us today.
All right, so Claudia, you have a PowerPoint?
I do, yes. I realize it's getting late and I'll try to speed through it as quickly as possible, but we have
please.
many
But,
ideas.
Okay, do you know how to display it? Are we gonna?
Yes, yes.
Oh,
let
you
me
do?
share,
Okay.
share the
All right, good.
screen. Oh, actually it says host has disabled attendee screen sharing. Is it possible to enable attendee screen sharing?
Chanel, do you know how to do that?
I think she promotes the speaker to co-host.
Oh, okay. Chanel, can you do that? Chanel? Oh, shoot. Okay. Daryl, have you been looking at the Q&A? There are 14. There are 14.
Yeah, I've been.
Okay, that's
I've
what
been
you've been doing?
I'm leaving some up there just
Okay.
But yeah, these are all answered.
Oh, they are. Very good. Thank you. So is that the same as chat?
I mean, kind of, sort of.
Okay. All right. Has Claudia been made a co-host?
Not yet.
Who said that?
I did, Claudia. Yeah,
Oh,
I can't share my screen yet.
Oh, yeah, Chanel?
And can Captain Freeman mute maybe?
There we go. Now I'm co-host. Okay, so here we go. Let's see. Let's make sure this works. Sorry, give me 1 second here. Oh dear. Okay, that should work now. Sorry, this is being difficult. Let's try again. Here we go. Okay. Okay, so first of all, I just wanted to thank you so much for including us today, and especially to Steve Simon for hosting the noise pollution hearing on August 4th and bringing all of the necessary resources and agencies and policymakers to the table. We are extremely appreciative of this effort, and it brought much needed hope in the multifaceted problem of noise pollution that we've faced this year. I wanted to take just 1 quick second to acknowledge the extraordinary and unprecedented times and the noise challenges we've had this summer as a result. They've been augmented as never before. COVID drastically changed how all of us work, play, travel, connect, and unwind. This year has also brought the deep and necessary soul searching on how law enforcement should be conducted and conversations around de-escalating conflict. We need to think outside the box and in a multifaceted way to properly address the challenges of noise pollution. We need to address everyone's need and right to sleep tonight, and also seek smart and meaningful long-term solutions, moving away from a complaint-based system. These solutions will help us thrive and take care of each other as a community. In May, I founded my group, Washington Heights and Inwood for Respectful Decibel Levels, which has since grown to over 800 members and has a parallel Spanish language group as well. Among these 800 members, we have many dedicated volunteers who are working hard on these smart solutions and initiatives, and I'm confident that by working together with the community board and the people and agencies you compelled to the table on August 4th, we can resolve our collective concerns in caring and equitable ways. As we spoke with the people who joined the group, it became clear that high decibel levels are not merely quality of life issues as they have been characterized in the past, but are actually health and safety issues. Dr. Arlene Bronsaft, a renowned noise expert who spoke at the hearing on August 4th and has been offering us advisement. Her groundbreaking study from PS 98 in Inwood showed that children consistently exposed to the loud noise of elevated subway tracks next to their classrooms fell a year behind their peers in reading ability by the end of elementary school. Dr. Bronsaft followed up on her work by collaborating with city agencies, resulting in the subway tracks being coated with a material to become quieter so that all the children could succeed in school. As we go back to school now, and children additionally need to be able to study at home more than before, the need to address the loud sounds in the neighborhood is more prevalent than ever. In my group, we have stories of parents putting their children to sleep at 6 p.m. so that they can get a few hours of sleep before the amplified motorcycles and stereo systems begin on the street at night. Noise has many health effects, including cardiovascular disease and a link to diabetes. Of course, the most well-known effect of noise is hearing loss. As you can see from this chart, anything over 85 decibels, which includes the motorcycles and blasting music, can cause damage within just a few minutes. And the fireworks, of course, exceed any exposure limit and are loud enough to cause instant pain. Noise is also used in noise torture by the CIA to psychologically break prisoners.
I'm sorry, Claudia, what was the last thing you said about fireworks?
Fireworks, as you can see on this chart, they're at 145 decibels, and the daily exposure limit is 0. They're loud enough to cause pain and hearing loss immediately.
Wow. Okay.
This here is a breakdown of noise complaints in CB12 in the last 3 months. As you can see, street and sidewalk noise, vehicles, and residential noise comprise 96% of all the complaints. These have been our focus, and I believe that we can collectively solve these.
So would you, so the fireworks would sit within street sidewalk complaints, I assume?
To be honest, I'm not sure if the fireworks are registering as noise complaints through 311, or if, since the 311 had people calling 911, if they're a separate thing. That's something that we could try to find out.
Yeah, okay, we should try to find out. Okay, go ahead.
Yeah. As we look at these complaints, these ones come in from 311, which is the current way to file a noise complaint. However, the 311 app is not currently available in Spanish, and this creates a barrier towards noise complaints being addressed equitably. This summer, we have also had many reports of 311 complaints being closed within 10 minutes without any action taken, although the ticket may say that there was. Using data that we collected in the Respectful Decibels group, I understand that the CB12 Public Safety Committee is investigating this issue. Many thanks to Curtis Young for being so responsive to our concerns. At the August 4th hearing, Mark Levine also expressed his support for investigating and mending this broken system. With great thanks to the energy and initiatives of our volunteers, we formed several working groups that aim to solve noise pollution at the source, balancing the need for quiet with our shared community priorities of outdoor socialization and recreation, businesses thriving, and the minimization or elimination of police contact. Our outreach group is committed to community building, connecting with community members, and helping each other take care of our health with respect to noise. Our initiatives include a public health campaign around healthy levels of sound and harmful levels of noise, alongside raising awareness of the noise code, which exists in order to protect hearing and health. We aim to increase awareness of now readily available decibel measuring apps, such as the CDC developed one called NIOSH, which enable anyone with a smartphone to check how loud their stereo or muffler or surroundings are. We are also engaged in community outreach and have an email and phone number by which non-Facebook users can contact us. We're additionally reaching out to members of housing networks such as supers, landlords, tenant association, and hopefully also other housing such as nursing homes, which we understand that noise has been an issue at Isabella as well. Here is a bilingual flyer that we've developed in collaboration with about 10 of our volunteer members. We have quite a talent pool of artists, writers, and designers. There have been many ideas around this flyer, and we may make other versions, but this is an informational one that we can distribute widely to parents, at laundromats, and doctors' offices. If CB12 is willing to partner with us on this, we would certainly be grateful for printing and distribution assistance.
I would change the heading. I think not enough people understand what decibels are. I would say something like maybe noise levels or something, but I think that decibels is just not a common term for most people, I think.
That's something I would like to change, but yes, agreed. Thank you. All right, and then so our transportation safety group is focused on reducing noise emissions caused by speeding, drag racing, and donut making, I guess, and modified mufflers, which has been just rampant this summer. We did a survey in the large Facebook group identifying hotspots, such as Sherman Ave, where residents have been subjected to dangerous driving all summer, and have been in touch with the CB12 Transportation Committee and other offices to promote expedited installation of speed humps and cushions to help deter this kind of dangerous driving. Speed cushions are temporary rubber installations, which have also been used in the city of Buffalo under the mayor's traffic calming initiatives. Speed cushions can be installed even along bus routes. In Buffalo, the program was initiated after a child was killed by a speeder. So I sincerely hope that we can do it here before such a tragedy occurs. We are also calling for increased red light cameras and support residential parking permits, as we are aware that much of the noise we've experienced this summer has come from outside of the city and often also outside of the state. Metered parking would of course still be available for business customers. Legislation, enforcement, and alternatives. Our aim is to move away from a complaint-based system and minimize the necessity of police involvement. One main way to do this is to link noise to license plates and vehicles rather than to people. This is already being done in the UK, where so-called noise cameras are being used to measure decibels of vehicles and record license plates in the same way as vehicle speed is measured by speed cameras. It is a way to address vehicles without mufflers and the boom cars blasting music to wake up the whole neighborhood. The license plates are then ticketed, and these tickets can be linked with points on the license rather than going the other route. We're also aware that the current system of ticketing for noise is not working. The equitable solution is for tickets or warnings to lead to confiscations of the noise-making equipment. This needs to be supported by legislators and the enforcement agencies. We are also interested in what collaborations can come from the Department of Environmental Protection, Parks Enforcement Patrol, the NYPD, and other partnerships. The parks we cherish here in Northern Manhattan, unlike Central Park and other city parks, do not have the same funding to hire private security guards as is done there because we don't have a conservancy. Often it is sufficient for a person with authority to ask a noisemaker to lower the volume, similarly to how simple police patrols have helped with some noise in the neighborhood.
Claudia, let me just say, yeah, I work for the Parks Department. I don't know of any park that has private security guards. But any public park, Central Park does not have private security. No city park actually has private security.
Maybe I've expressed it incorrectly. I listened to the CB12 Parks meeting before, so
I think I made the same point at that meeting.
Okay.
I think we talked
sorry,
about the
misspoke.
conservancy.
Yeah, well, but they don't have their own, I mean, there are conservancies that pay the Parks Department so that we hire additional Parks Enforcement Patrol officers that are assigned to those parks. But those are not, those are Parks Department employees. They're not private security.
Right, but they're getting an allocation of additional staff, which we don't have access to.
Right, but that's in very limited cases, and it's but I don't want anyone to think that we have private security guards that are patrolling our parks. Okay, I'm sorry. Go ahead.
My apologies. I mistook that. So on the next point on data, I just wanted to say that our group has an exceptionally dedicated data team. The goal is to gain insight into the sources of noise pollution and pinpoint hotspots to prioritize remediation. I've already mentioned the week-long 3-on-1 study that Jen Donahue did and presented on here at CB12 in July. The study is helping shed insight into how to fix 3-on-1 and the tracking of complaints into the board stat system. We've also begun collaborating with Beta NYC, which was a result of the August 4th hearing. The speed hump cushion study was also put together by this team. They're ready, willing, and able to collect and sort data on anything we need to figure out. One more area we are working on is signage. The goal is to determine how and where signs may be placed in order to prompt noise reduction. Our aim is to collect hotspots for signs and partner with local businesses and buildings and parks. Senator Jackson already expressed his support for this at his Senator in Your Corner meeting. We realize that we need partnerships and collaborations to succeed. Our goal is to share information and resources with agencies, officials, and organizations who have a mutual interest in mitigating noise pollution. Among other things, we have reached out to NYU's Sounds of New York City, or SONIC for short, program, which is aiming to mitigate noise pollution in New York City through technology. We have shown up for meetings with elected officials, some of whom have taken an interest in our initiatives.
I'm sorry, Claudia, what are these noise sensors?
So they are similar to what's being done in the UK. They are able to detect decibel levels of sounds, but also classify sounds. And so what NYU is doing is they're partnering with communities to put the sensors up and help the machines get smarter at recognizing the noise source.
And what happens with that information? How is that utilized?
It looks like they're in the development phase at NYU, but the goal is to use that in enforcement.
Yeah, I'd like to hear how that works. Okay.
Yeah, I can send a link about that.
Okay.
It looks like they're still in the development phase, which is perhaps interesting since we could help them develop. So in conclusion, I just really want to thank CB12 for taking our concerns seriously and providing the forum, the communication and connections towards having the conversations that can create lasting and meaningful change. We have a lot of work to do, but I'm confident that we can do it.
Well, thank you for your presentation. Let me ask you one other thing. Did you say earlier that there's a program you could put on your phone to measure decibel levels?
Yes, absolutely. So the CDC actually put out an app called NIOSH, N-I-O-S-H, that allows you to measure decibels. That particular app is for iPhone only because the iPhone apparently has a better microphone. But it is CDC approved and it's very stable. And there are other apps for Android as well.
Well, I wonder if anybody's recognized using that in any kind of legal actions. Whether
That's a challenge there.
I'm sorry. Who's speaking?
This is Natalie. Yeah, we have had constituents use those apps.
Yeah.
If I may interject here.
Yeah, go ahead.
In sites where there's been really long-term extended construction, and that information, that these community groups have put together has been dismissed, but it cannot form the basis of a violation. Okay. So that's why it's intriguing, the research that you guys have done into something that someone could install that is recognized, and has backing of research, and it's kind of a uniform tool that's installed in various corners. I think there's a lot of potential with that.
Yes, and I should just add about the NIOSH. I don't think we were seeing that as a way to enforce things because we understand that needs the proper decibel meters that the Department of Environmental Protection has, but the NIOSH app would be part of the public health campaign where we measure the decibel levels around us. And so, one of the things that happens is when people are around loud decibels all the time, they lose hearing. And so people who are making noise may not realize how much noise they're making because it doesn't sound as loud. And so by empowering everyone to check, well, how loud is the noise I'm actually making? It helps us come to a more standardized discussion.
All right, are there committee members with any questions? All right, There's a hand that's raised by, for, is it Karen Jolicoeur? I may not be pronouncing the name correctly, but is there a way in which she can speak?
Yes, you can promote her to a panelist.
Chanel, do you see her name? Karen Jolicoeur?
Hey.
Jolicoeur?
Hi there. Thank you. Can you hear me now?
Yes, are you Karen?
Yes, I am. How are you, Steve? And
Okay,
thanks,
go.
Claudia. And thanks to Claudia for her vision in founding the group. So I would love it if someone on this committee could take on as a related issue the 311 call getting closed out without attention. I think that is something that needs to be addressed on a systematic citywide level. We should not be seeing 311, which is an amazing resource if it functions as it should be functioning, just decimated, right? So 311 calls are being closed out with no attention, and we're being told either that situations have been addressed and mitigated, or situations have been found to be unfounded. And we know that this is nonsense. And so one of our fundamental tools as a community to address our noise concerns is being, relegated as useless. Can anyone on the committee address this since the last meeting when we identified this as an issue?
I think also related to that, Karen, are the calls that, because of Jen's study, weren't even making it into 311. The call would be placed, we would have a record of it, the caller would have a record of it, and yet it wouldn't appear in the system. And that seemed to affect, I can't remember what the percentage was, but maybe a third of the calls were not even making
Yes.
it into BoardStat. So there's two.
Exactly. So BoardStat was something that was new to me since the founding of this group, that there was a CompStat version of something for 311 calls, BoardStat, right? So there's a couple levels of this. Why are we having 311 calls closed out as unfounded or addressed when clearly it's not the case? And why are 311 calls not properly populating BoardStat, which it seems like it should be a purely mechanical process, right? These things are not okay. So we addressed these things in the original meeting a few weeks ago. And have we learned anything? Is anyone accountable to reporting on these things? So I yield back. Thank you.
All right, well, you certainly raise a legitimate point. And it was my understanding that this question is being looked at least by Councilmember Levine and maybe by one of our other committees. So I'll check
Yes.
on that. I'll put.
Mark seemed to like hone in on this as an issue that he could address, and he seems like the kind of guy who could take this on. But
Right.
where have we come in the last 4 weeks?
Right, I know. It's a good question. All right. Any questions from our committee members, or can we move on now? Very good. Thank you, Claudia.
Thank you so much.
All right, Tanya, the floor is yours.
Questions?
What is that?
There are hands up.
Oh, I'm sorry. 1 second. Is that Richard?
He is.
Okay, I thought that was an old hand. I thought you were an old hand.
What a perfect description.
Yeah. Go ahead, Richard.
Very, very brief. I mostly comment because I appreciated the depth of research and other issue work that went into the presentation that was just made. But I also want to make sure we don't leave this issue without at least an acknowledgement of the heavy lifting that our colleague Tanya Bonner has that our colleague Tanya Bonner has done on this issue, both in the community and especially within the community board, to see that our committees are aware and that there's an awareness throughout the board. Double thanks all around.
All right, well, that's a good intro for Tanya to now speak. What? Oh, I'm hearing bizarre sounds. Hello?
Tanya, I think the sound is really bad.
What's happening here?
I don't know.
Sound from Tanya.
Hello?
Hello?
Okay.
Can we pick? Wow, Rich. Hello? Can you hear me?
Yeah, go ahead.
Can you hear me?
Yeah, go ahead, Tanya.
You can hear me now?
Yes.
Oh, I'm sorry. Yeah, it's just getting late. I want to say thank you so much, Richard, for those kind words. I really appreciate it because it has been a long haul. As a lot of people know, there's been a lot happening on this issue for years behind the scenes. So thank you for that. I, really appreciate that. Also, I just wanted to just touch base about our what we talked about, what I brought up at the August 4th noise pollution hearing was the idea of the task force to come together to bring all these entities together to begin to talk about solutions. Because, it's important that we start bringing people to the table to start to talk to each other, talk across departments, talk across, communities and community groups and things like that to sort of come up with these, to talk about what the possible solutions are, what the ideas are, and then to begin to figure out how we can implement some of these things in our community to make this community to sort of mitigate a lot of the noise pollution that's been going on. And so with that, I wanted to say that, there's a group of us hard working on trying to, working on the structure and everything of the task force. Our group as a whole, we did temperature checks, and the group definitely felt strongly that we want the task force to be community led. While we're bringing all of these different entities, we want to bring all the different entities together, but we feel it's important that this is something that is coming out of the community in terms of leadership on this issue. I don't know if I can share my screen. I hope it doesn't knock me out, Steve, but I wanted to share our mission statement. A few of us worked really hard on looking at, oh, thank you, Chanel. You were right on top of that one. I'm going to hope that I can do this because, yeah, I can. Okay. All right. So here is the mission statement that we've come up with. As people can see, I'll read it out loud for those of us who might have hearing sight difficulties. Mission statement, and of course, this is going to be translated into Spanish before we put anything out officially. But it says the Wahi Inwood Task Force on Noise is a broad community-led coalition of neighborhood groups, local residents, small businesses, and public health experts. We're dedicated to working proactively to address the long-running public health impacts that threaten the well-being and livelihoods of residents in Upper Manhattan. This group seeks to accomplish this by unifying our diverse neighborhood and elevating Black and Brown voices in our leadership and direction. The task force seeks to achieve these goals via holistic approaches that are not limited to, but include engaging agencies from across government, elected officials, and community leaders, as well as advocating for effective policy based on the well-documented scientific studies that shows excessive noise is harmful to public health. Our goal is therefore to positively transform the health and well-being of everyone in our neighborhood. So that's our mission, our mission statement that we have. And as you can see, our goal really is to make sure that we are bringing all the relevant parties to the table. We want to create a space for people to dialogue, to talk about potential solutions, and work together to identify what the priorities will be, what people can do monetarily, what roles people will play, where the accountability will be on certain issues. And so we think that is an extremely important role. And we also, as I said, mentioned that we really want to make sure that we are including voices of the diverse voices in this movement, making sure that those voices are represented in anything that we do. And we could feel that's important, especially being a predominantly Hispanic community. I also wanted to say one of the other things that we did since the hearing is we started looking at just people have been suffering a great deal, so a lot of things have been coming in. One of the things that we did was look at parks issues because it seemed like a lot of the complaints were coming from there. And so, Steve, I did send you that information, but it's not a scientific thing, and it's okay that it's not. But we did ask people to contribute areas that they felt were problem areas in the community, and they did identifying Inwood Hill Park as one of the major places where people were doing activities, illegal activities that are against park rules and also city rules. And we also identified several other parks like Fort Tryon, McKenna Square, and Loftus Playground even, and a number of others. Most of the complaints were coming from Inwood, like 70%, though about another 30% were coming from Washington Heights. People listed the following activities happening: loud music, loud parties, drinking, illegal drug use, large gatherings, fireworks were all happening. And there were other sort of outlier things that people were talking about, such as motorcycle riding, things like that. But those top 5 categories or top 6, we are really concerned about because, you know, these things can also, there's a connection, as Dr. Bronza also mentioned at the public hearing, between upticks in crime and lack of enforcement on these sort of quality of life complaints. And so that's why I thought it was very illuminating. People were filing 311 complaints, and as was mentioned earlier in Claudia's presentation, these things were people were saying nothing happened as a result of filing those 311 complaints. And at this point, when it comes to quality of life, that's the only avenue people really have to take. People sometimes tried to contact their police precincts directly. And some people felt that did not lead to at all lead to any sort of solutions. And people didn't realize that the Parks Department has an enforcement unit, like about half of the people. And I thought that was pretty telling. So I think what this tells us, one of the things this tells us, that we need to bring people together, because I think a lot of people don't know about all of the different agencies and entities that could come to the table to bring some really creative solutions to these problems. And I think it's important that we provide support. And I would love to have everyone's support who's on this call. We're going to be, trying to bring all these community partners together to really come to the table to do this. But we really think it's important that the community is really a equal partner at that table to make sure their voices are heard, and that their interests are considered in this. And as we said, we want to make sure that we are valuing it and listening to minorities in the community about how they've been impacted by all of this, and also their leadership and voices on this. So that's where we are. We are at the point, we do have some support as well for this task force from some of our electeds. And we want to really over the next month convene our first meeting to begin to have these dialogues and conversations. And we really love to have, Steve, your committee, really support that effort, as we're really saying this is a public health issue. I don't want to go on because it's late. So I just want to, and I know you probably have other things on the agenda as well. So I just wanted to keep that short. And anybody have any questions? Do you have any questions, Steve, or?
Well, I'd like you to email me the emission statement so I can quote for the minutes. It's a very good statement. No, I don't have any questions. Does anyone else have a question?
And thank you, Richard, again. I really appreciate that because I want to say this has been a hard road. I have been dealing with this issue for 15 years, and I have been fighting for this issue since I've been on the community board, which is almost 3 at this point, and doing this work around my professional life, my personal life, and also not getting any sleep for months because of the noise has not been easy. So I really appreciate that and what you said. Thank you so much. Much appreciated.
All right, very good.
Can I ask something? Yeah.
Yes, Mr. Cochran, you can ask anything you'd like.
Oh, just a couple things from the two things from the chat. One said regarding Karen's question about 311 not showing up on board stat, there are people at Beta NYC actively working on this question for Washington Heights Inwood for respectful decibels. So that was one. And then someone also commented that, you know, Inwood Hill Park is out of control as it relates to this. I was wondering from that too, like, is there maybe like a top 10 or 20 list of hotspots in the community that you're focusing on, or?
I guess I can answer some of that.
No, one second. I think this is I think that's a good question. I'd like that either and or both Claudia and Tanya perhaps should respond to.
Yeah, that'd be great.
And that's, I think you meant it for them.
Yes.
Is there a top 10? Do we have something like that? Is it possible to put together something like that based on the 311 calls and other information we have?
Well, 311, I can say that our board stat could give us that pretty easily. It would just be a matter of running that information. Because at one point, you know, I had gone to the 33rd with that type of information actually several years ago. Well, actually last year, I believe it was, last spring with the similar data with them about some of the hot spots around where I am. So showing that, so you can pull that pretty easily And also, I'm sorry. And also I was going to say with the parks, we do have that information because people in the group identified the problem areas, you know, and we do have the ones that show up the most. And we had more than 10. We had at least definitely had 10 of those, but we have identified some of the more areas at least in that area, the park.
Hello?
Yeah, I think it would just be good, you know, maybe to help people focus and help
Tanya,
enforcement.
it's Karen. Daryl, thank you for that answer.
More activity.
Can you hear me?
Oh, no, I agree. I totally agree.
Yeah, we can hear you, Karen.
Okay, so just in case, I just want to disambiguate a little bit. Thank you for the response on the 311 calls not populating board stat, right? That is one question. But separately from that, we have the situation where 311 calls are getting closed by the precinct as 33rd or 34th as unfounded or as mitigated.
Well,
so these are different issues related, but not the same thing. Yeah,
they actually are related because people are they are related because, and we've talked about this at the public hearing very extensively about 311 calls being closed out. People indicated that. So when people are filing 311 complaints, that's the tool that the community is given, right? So if those complaints are being closed out without being investigated, that is the same issue. And we do need to, and I don't think that anyone was against looking into that. I think what needs to happen is we need to bring that issue to the table when we have our task force and have the parties that would be a part of that. Like, you know, I encouraged, you know, Steve, thank you so much for bringing Beta NYC to that hearing. And we were able to coordinate that and bringing the police department to that conversation. So, and Mark Levine obviously expressed interest in this issue. So bringing all those parties together to be able to figure out what is actually going on and
Right.
and what, that's really the
Right.
answer. I mean, so
So,
that's
We-
what
we-
I'm.
Tanya,
I'm
I
sorry.
agree that
I was.
I
I'm sorry.
agree
I'm
that
sorry.
they're,
I'm sorry. I'm sorry. I was speaking. So yeah.
Yeah.
So yeah, I was just saying that that bringing these people together to the table will really make a difference. Instead of taking it piecemeal and keep it. I think there's a way to do it that will help us to get closer to the solution.
agreed to. I was speaking as well. So the factor of the related issues does not diminish the fact that 311 calls populating board stat is a mechanical
I'd rather
issue,
be-
right? So
But-
we
but I-
have the
but
issue
I-
of things being closed by human decision,
Right.
things
But-
being closed by human decision as unfounded or as dealt with when they maybe have not been. And then there is the mechanical issue of
But-
things populating board stat or not populating board stat, and they are related, but potentially not the same. Potentially
Okay,
related, but
Okay, but
potentially not the same.
Karen, I don't quite understand this latter issue. Isn't board stat based on data from 311 calls?
I don't understand it completely, but the fact that there are issues that are being put into 311 that are not then populating board stat seems to be that there's a flaw, right? So there's the human flaw where a police or whoever is the arbiter of, I close this 311 issue as unfounded. I close this 311
no.
issue as we showed up and we
No.
dealt with it or did not deal with it. But
Right.
separately or not separately, we
Okay.
need to understand
Right.
is
So
the fact
if
that
I could-
311 calls are
Yeah,
supposed
right.
to populate board stat.
Wow.
All
If
of
I
the
could,
311
so
calls
you're
are not making
basically,
it into board stat,
Okay.
then that's
you're
an issue.
basically
Separate.
saying that there's underreporting happening here.
Yes, there is some mechanical
Right.
issue
Yeah.
with the underreporting that is separate, right, right, Claudia, right, Tanya? That is
No, this
separate
was
and
addressed.
apart from.
Okay.
Yeah.
If I could too,
Yeah,
at the Parks Committee meeting earlier this week, we got a little off topic, but this was addressed in some fashion that
This was
you know,
addressed at the public hearing. Beta NYC did
Yeah.
address that. Yeah.
Yeah.
yeah, well, isn't this something that?
So,
Am I-
basically, if I could, one of the things that our board member Barbara brought up was that precinct community council meetings have not been happening.
Okay, but that's
started.
Darryl, that's a different issue. But
They
uh,
hope to bring that up. But no, it deals with the issue of closing out.
no, well, yeah, okay. Oh, closing out the calls, yeah.
Closing out the 311 calls.
Closing calls and the mechanical population of board
Okay.
stat from
Okay,
311
Karen.
calls are separate.
Okay, yeah, Karen, I think we have the point. Thank you.
And
Thank you.
I'm sorry, if I could just move on to the chat real quick or to the Q&A.
Go ahead, please.
We are taking, to the anonymous person, we are taking questions. So if you have a specific question, please feel free to type it in and just also identify yourself for the notes. Thank you.
Okay. Claudia, are you still with us?
Yes.
How many people have joined the Spanish language social media site?
We have over 50 now.
Over 50?
Mhm.
All right, that was a very good move on your, whoever came up with that idea, very good. Okay. All right, so I did want to have a resolution tonight on the fireworks issue. It's taking me more time to put it together. So I do intend to bring it up at next month's meeting. I've spoken to Curtis Young, and the intent would be to have vote. I'm sorry, the intent would be for it to be a joint resolution from both committees, public safety as well as health and environment. And I certainly want to highlight the situation with the fire that occurred at 180, I think it was 184 Nagel. And I believe I'm told there was another fire, not as severe, at 551 West 157th Street. And I want to bring up the case of the woman, I believe her name is Mrs. Borelli, who passed away after suffering a heart attack, which her daughter believes was brought on after having an anxiety attack from the fireworks. So I want to have a specific resolution just dealing with the fireworks issue. I think it's important enough to deal with it as a separate issue. So expect to see something on next month's agenda. I'll try to get it done early enough so I can send it around to people beforehand. We're now passing 10 o'clock. And I think we're going to just junk the rest of the agenda. We're going to discuss the budget priorities next month anyway. And I've sent out to everybody the latest reports on the DEP service requests and the update from DDC on the water main and sewer installation projects. The big news there is that the water main installation work in Inwood, it has been completed. Sally, is this brief?
Well, I guess my question is, with what's been addressed by Claudia and Tanya, is how to move most quickly forward to address these problems. And I understood that CB12 at the hearing committed to doing a task force. So I just want to make sure that we're not doubling efforts or replicating efforts, but that, you know, we're moving towards the solutions in the fastest way. And I guess you and Curtis have the ability to get these agencies to show up. I mean, they sort of have to. That's your responsibility as chairman, and that's their responsibility as agencies. They have to report back to us. So I just want to figure out how we can, and we don't have to discuss it now, but I think it needs to be a discussion. How can we most quickly move to address these concerns?
Steve, can I respond to that?
Yeah, go ahead.
Yeah, as I said, I was the one who actually brought up the task force at the hearing and said that we should go forward with that. So that's what we're doing, but it's going to be community led. So that's exactly what we are doing right now, is doing a community led task force that will bring all of these people together. We have had support reach out to us from who are willing to, who have the capacity and the connections to help us to move this, to get these bodies to the table. So I have full confidence that they will be able to do that, as they are highly positioned to do so. And so that is the solution. We have already offered the solution that we will have the task force. We are working on that. We have our, as you saw, the mission statement. We have people committed to working on that. And that's what we're going to do. And so, yeah, I think that is the best way forward, is to bring all these people together to the table, to talk about, to come up with these priorities in terms of how to tackle these things, as Daryl was alluding to, looking at things like in terms of what are the most, the top things and what we can tackle right now, and sort of creating that kind of priority list of the things that we need to deal with. So, yeah, we have that. I don't know if anybody heard what I said, but we did have that. And we are moving forward on that task force. And as I said, Community Board 12, of course, Steve and all these people will be able to be a part of that. But we want to make sure that's coming from the community, that is representative of the community, that the voices and the needs are being, that the voices of the people of the community are being heard, and being heard fairly. And so that's why it's important. But and we obviously have support here. Steve is allowing us to talk about this and deal with this. So we have that support. And so we're ready to move forward. Does that answer your question, Sally?
No, but
okay.
Okay.
I'm sorry.
I just had a couple things.
Okay, I don't want to have a back and forth on this.
I just had a couple things from the chat, Steve. Sorry.
Yeah, go ahead, Darryl.
From the Q&A. One, just kind of pointing out a spot that's bothersome for motorcycles and cars with their mufflers around Broadway and Seaman. Just pointing that out.
But Broadway and Seaman don't intersect.
That's what I thought. But around 204 Cooper.
Okay, in that area, yes.
That area, yeah. And then also,
I saw a very disturbing video a couple of weeks ago of some crazy car speeding all over that neighborhood, and I couldn't believe it. He didn't smash into anybody. I'm sorry. Go ahead, Darryl.
That's okay. And the other is just really kind of pointing out the urgency of this. Obviously what we're doing is a process and time consuming, but folks want it done now. So, or want solutions yesterday. So just keeping that in mind, I just wanted to.
Right.
Okay, I just want to point out that that we can work on more than one track, and this committee can still do work in this area and should continue to do work in this area. And as I mentioned earlier, one of the things I want us to do is to deal with the fireworks issue. Okay, so unless I hear differently, I'd like to adjourn the meeting. It's 10:08.
Question.
Who is this?
Naisha.
Oh, go ahead.
I just have questions about the selection process for this committee, because I do hear that we want the community to be heard. I hear that we want diverse opinions, but aside from community board, how are we going to ensure that our community is part of this committee, or how are we going to ensure that the people that are being directly impacted aside from the community board are included in this committee? Because I have serious concerns about the fact that that's going to happen.
I'm sorry, in our Health and Environment Committee?
Oh, we were just discussing the committee, correct?
The task force, you mean?
Yeah, the task force, sorry.
Oh.
So how are we going to ensure that people are on this like people outside of the community board and people that are directly impacted are on this task force, and that we're just not driving the rhetoric that's reinforced by one group versus another, and we actually have diversified opinions, and we're reaching out to the community to be part of this task force?
Okay, well, this task force is being formed by, Tanya should answer the question.
I would like to just speak on this for a quick moment, because I did found the group, Washington Heights and Inwood for Respectful Decibels.
Claudia, this is not really a question for you. This is a question specifically about the composition of the task force, and Tanya is the only one here who is involved in that process.
I understand.
Yeah, thank you. That's why we wanted it. That was the main reason why, I brought, the different scenarios to group, and people really want this to be community led. And that was the reason why, is because of the fact that in people's experience that when task forces are formed, unfortunately through our board, that there is not that representation of the community, that it doesn't represent the interests of the community and the voices that really need to be a part of those particular task forces. And so that was the concern that came out of it, and was the reason that people really wanted this to be community led. Not saying that the community board will not be a part of the task force itself, but they are not forming the task force, nor they would be leading that task force. That would be something that the community would work in tandem with other community stakeholders. And that's why we're all coming together to really talk about who some of these people could be in terms of the community stakeholders. Of course, we know we have to include all of the electeds, we're including the community board, but we're also including small business, as we said in our mission statement. This is a process, as it would be even if we had, it is a process to really find out, go to the people, go out to people and really see if they're interested in being a part of this conversation. But we, by having this community led, the community is leading that discussion in terms of identifying the people, deeply entrenched in these issues, from the grassroots level. They're coming up with these potential people and potential participants. And of course that would include all of the city agencies. So that's not that, they're already there. But yeah, that was the reason that we wanted to do it that way, is because we really have learned that it's important, especially with an issue like this, dealing with quality of life issues that's impacted people on a very personal level in our communities, in our residential communities, in our business communities, and other communities, that we bring all of these people, that the community are really identifying the people that should be on it, and so, yeah, it's not, this is not totally scientific, but it's definitely something that, by having a community conversation, having this being open, it's fluid. It's something that is part of a discussion, and it's going to take a little bit for us to really, figure out all of the different entities that, would be interested in being a part of this conversation. And, but, I think this is myself personally think it's the best way to go.
Okay. All right.
in terms of making sure. And there are models. I was going to say too, there are models in the community where this has actually worked. Like we've had models in the community where this type of process has worked really well in addressing issues.
Steve, we have a hand up. I just want to point out, and then also I have an announcement whenever it's time for that.
Natalie, is that your hand?
Well, it's my hand notionally. My hand isn't small and blue, but yes, I had a few announcements to make if I can rob a few seconds after your discussion is done, and I didn't want you to without.
Okay. Well, are we up to are there any other questions or comments? Can we move on to announcements?
I just need to make one comment. So coming from the Respectful Decibels group, it seems like we're working on two tracks. There is a group that's doing the task force, and Respectful Decibels is it's a Facebook group of 800 members who are free to choose as they wish. And we definitely do want to partner with the community board.
All right. Thank you for that. Okay.
Hey, one more thing. I just thank you, Tanya, for answering my question, but I just want to emphasize and urge everyone that is involved in the task force selection process to reach out to people that aren't voluntarily displaying interest, because I think there are parts of our communities like my grandmother who are affected by this issue, but don't have the time, aren't aware enough, or these aren't the populations that we're targeting when it comes to this. And I think that it's important to be inclusive, aside from varying perspectives, race, and gender. I think we should think about age groups as well, and just ensure that there's diversity in all senses.
Oh, absolutely. We're right there with you. Thank you, my dear.
Okay. All right. Are we ready for announcements? Natalie, go ahead.
Thank you, Steve. I am going to limit my remarks because it is late, and I did email you as the meeting was going on a few things, including Presbyterian's response to Gail on the Allen Syke, slightly different from what you read that had been addressed to the senator, but along the same impact. There's also an email that I shared about volunteers being recruited again for the mask volunteers for MTA that Sally mentioned. They're doing another set of dates next week. The only announcement that I do feel compelled to make out of our COVID newsletter today is hearing the reports, especially from our EMS friends. There is the application is open to nominate an individual or organization doing outstanding urban public health work for the Joan H. Tisch Community Health Prize. The nominations close in December. This is something through Hunter at CUNY. The link to the nomination form is on Gail's newsletter and would be in her announcements on the borough president's website. And then, of course, today is 20 days, T-minus 20 days to fill out the census. So all of you who are doing this incredible work of reaching out to the community about noise and quality of life and testing and tracing, but might as well, mention while you're at it, make sure people have filled out the census. Sometimes a familiar face with an affinity on a certain issue, like the ones you guys are reaching out on, will be what convinces someone to complete that questionnaire. And even though Washington Heights Inwood Community District 12 is doing better compared to the rest of Manhattan at 69% self-response, because this district has double the population of the next populated district. In fact, the number of non-responders represents more bodies that are not being counted. So don't let those statistics fool you, although it feels nice to be beating the next district over. There are still many people not counted here. And then overall, we want to make sure that Manhattan numbers are up because who wants to be beat by Staten Island? 5 minutes.
Oh, God. No greater shame.
And if I could piggyback on her report. Her comments.
Okay, you can, well, that's really up to Natalie. I can't, I can't give you approval to do something like that.
It's related to her office as well, so.
Okay, all right, fine.
Absolutely. And I am done. Thank you. I yield to Daryl.
Thank you. In my other role with the City Commission on Human Rights, and this is for the board members, we started a series through the Borough President's Office on various topics of diversity and inclusion. We're doing a workshop next Monday, the 14th, for all Manhattan Community Board members about working with transgender and gender nonconforming communities. We already did workshops on race and color, as well as understanding Muslim communities and Islamophobia. But we'll be doing all of those again one more time later this month. So if you haven't signed up to do one of those yet to participate, please do.
Are you recording this, Daryl?
It's the Borough President's Office. I don't think we are recording it. No, it's yeah. So anyone can ask whatever question in a safe space.
Okay, very good.
And then there was one last question in the Q&A. I'm sorry.
Go ahead.
Maybe folks know, is the sheriff's office a resource for these the noise issues that we've talked about?
Not
I
that
also
I'm.
have a quick announcement. I'm sorry. I know everyone's asleep. I have a quick announcement. It's really quick.
Yeah, could you just hold a moment?
Okay.
The sheriff's office evidently has a role to play in terms of the enforcement on mask wearing in public, in the open streets, restaurants, and social distancing. I don't think it has a role to play in terms of. I could be wrong. I think Fabricio said it has a role to play in terms of dealing with the illegal distribution of fireworks. But on general noise issues, I'm not so sure that it does have a role to play. But that might be worth looking into. I mean, there aren't exactly that many sheriffs, but we should find out what it is that they do. Naisha, go ahead. Naisha?
Yeah, I'm here. Sorry. So I just wanted to say, kind of related to what we were just talking about in regards to the task force, the Assemblywoman, Carmen De La Rosa, is having Environmental Justice Day of Action as a way to culminate our community cleanups. But instead of just focusing on littering and pollution, we're going to incorporate other environmental factors, including noise pollution. So we're having city agencies come in and discuss that, which we're hoping to plant flowers throughout the neighborhood. We're hoping to get City Harvest and other organizations that work on food deserts to come into the district and possibly provide healthy food. And if you all have any suggestions, I would be happy to take them because I am the one coordinating the event. But also I just wanted to alert you all to that because I think it'd be important for us to take part and promulgate it as appropriate. It was supposed to take place this weekend, but we decided that it'd be best to wait until after the Jewish holidays. So we have a couple of weeks to continue planning and solidifying. So if you all have any suggestions for organizations we could partner with, community groups that would be interested in participating, I'm happy to take those.
Do you work for Carmen?
Yes, I do. I just started with Carmen in June.
Oh, very good. Now, what did you say just a moment ago that there would be something involving the city agencies discussing noise pollution?
Yeah, so we, instead of just focusing on litter and picking up garbage and the issues that have come from, that have rose to the surface or been exacerbated by the quarantine, we're gonna make it more broad and talk about environmental justice overall, which includes noise pollution, adequate transportation, access to healthy food, stable housing, and displacement. So
So-
it's a more broad about the environment and like the impact that it has on our community. And we thought that this was the most appropriate time to do that because
So
the
that,
COVID pandemic has exacerbated a lot of those issues.
so this will be like a Zoom event, a public
So
forum?
it's gonna be still a community cleanup. It will be in person. We anticipate that it's gonna, so the first hour or so, which is where the workshops and the distribution of items are gonna happen, is gonna happen on 185th between Audubon and Amsterdam at Yeshiva's Plaza. And then from there, we're gonna break off into groups like that people have chosen to do the activity of their choice.
So there'll be an open discussion on these environmental justice issues, including noise pollution at that event outdoors?
Yeah, that's what we anticipate will happen.
And did you say what the date is, or has that been
We have,
determined?
so I will get back to you with the exact date. We're aiming for
Okay.
the first Sunday in September because of the holidays. But we have not decided it yet.
The first Sunday in October?
Yeah, October, sorry.
All right, yeah, well, definitely get us that information. And maybe if you have it by the time of the board general meeting, that would be a good announcement to make then too.
Yeah,
Okay,
definitely.
all right, anything else? All right, very good. All right, so it's 10:23. The meeting is now adjourned. But by
Thank
unanimous consent. Okay.
Thank you.
Yes.
Good
Okay, bye.
night, all.
Bye.
Bye.
Steve Chanel, I'm emailing you the Q&A stuff.
Good night.
Good night.